it. Don't throw it, don't throw it. Please pass. Ladies and gentlemen, who be the person? Please show us some love, show us some love, show us some love. 2 more people. DJ, it's okay, it's okay, it's okay. Pass it, pass it, pass it. I don't get time, I don't get time. Time. Don't wait, oh. We are pass it. Where is it? Egbon, stand up like that. Ladies and gentlemen, show him some love, show him some love. What's here? Where is it? DJ, just one person remaining. Who is the unlucky person? Come on now. Come on now. All of you that are throwing it. DJ, play. Has it reached that side? We have pass it to this side. Pass it to this side. Just one person. Pass it. Pass it. Ah! Who is throwing it? Where is it? Oh yeah, bring it. Nakwana. Pass it. Pass it. Allola Debussy. Hey, I feel the vibe in this place. Come on now. Mr. Manino, the Jesus. Hey, pass it. Show wine minute. Pass it. Pass it. Come on. Hey. The last person. Power Day DJ Zando. Power Day DJ Zando. Who is it, ladies and gentlemen? DJ, play. Controversy day. Play.
Tell me what you see when you look at me.
My problem is that too savvy. Pass it. Show you the wine in it. Pass it now. You don't fear. Yeah. Pass it. Don't throw it, though. Pass it. DJ, destiny is in your hand. DJ. Ooh. Ladies and gentlemen, show us some love. Please just come and come with that object. Please show us some love. Put your hands together. And all of you, they do like a way Joe Bailey. Alright, DJ, just kill it. Kill it. Wait, do you even know if you want to give them money? I heard that the governor of the state is coming. Do you know if he has sent us money that we should give them? And all of you are doing like, I beg, pick number, Jare. I say pick number, he say 2. School, right, Iwana? Oh yeah, come up. Let everybody see you. Come up. Don't mind me, we're catching fun. Please celebrate them. We're starting in a jiffy. You know, we are youths now. We must be energized. As I entered, everybody just they look. Okay, it's the hunger. Don't worry. You'll soon be fed. We don't get time. We are straight file. Now, the very task I want to give them, some of you know it, some of you might not know it. It's called the 7-pin game. And, okay, yeah, take number. Ogbo, Ewa. It's like this guy is just destined to be the first. And please, you have to be as audible as possible. But don't worry, everybody is going to have a good time. Oh, yeah. So you're going to help us. And the way you're going to help us is that you'll be as silent as possible. And you guys, you also project as possible. So it's called a 7-pin game. For instance, you start. You're going to say 1. She would say 2. You will say 3. You will say 4, 5, 6. When you get to 7, you will not say 7. You will say pin. P-I-N. Then we go 8, 9, 10, 11, 12, 13. When we get to 14, you will not say 14. You will say pin. Why? 14 is a multiple of 7. So, we continue. Then you go, you say 15, 16. When we get to 17, madam, you will not say 17, you will say pin. Why? 17 has 7. Then we go 18, 19, 20. 21 is what? Pin. 22, 20. So the rule of the game is very simple. Any figure that is either 7, a multiple of 7, or has 7. Do we understand? So please, don't forget our deal. Try as much as possible to be silent. Let's do a test run. Test run. And another rule of the game, if you say if you say mombo, otija, you will just go and honorably take your seat. You understand? So this one a test run. Please be as audible as possible. Let's go. So I think we understand right about now. So we're gonna start now. I know say if I start from this guy, Alaja go don't cram am say na she be 7. So she go just so mad daru. Egbon, start. Please show her some love as she goes back to her seat. Put your hands together for her. All right, Alaja, start. Please be as audible as possible. Wait till you talk. No, it will distract them actually. It will distract them. Passing mic. So the deal is that just be as silent as possible, be as audible as possible. Do you understand? Alaja. 17. Please show us some love, show us some love, show us some love. Erora kwada si aye. Please start. Uh-huh, 17. Please celebrate her, celebrate her, celebrate her. It's 15. Please show us some love, show us some love, show us some love. Please celebrate her. With, how come none of the guys have Avec me, no call now. You know. All right, let's start. Be like clumkey paralysis. Oh, muleno. We've got 2 guys standing, 2 ladies standing. Please, if you know that you understand that it's not easy to be a man, please celebrate these men here. And if you know that ladies are special, please celebrate this too. Which kind of gender inequality with this one? Oh God, don't worry, I know what to do for you. In this life, every privilege that is endemic on hearts is for the women. And they say yes. You feel get girlfriend, now you go to sponsor her. Now she go to collect urgent 2K. But as a man, you ask a girl for money, they say that you have problem. But don't worry, it's because of you girls that we are working actually. Yes, sir. Sakpa. Sakpa is bad. My sister, please start. Hello, Choco, hello, Choco. Want some baby drink, Danny? Just drink it, just drink it. Please show him some love, show him some love. We've got 3 people standing. The very last man standing. Come on, show him some love. Egbon, what is your name?
Oluwagbotemi.
See, all the people with a crush on you, they are there. Madam, please, what's your name?
Bella.
Bella. Is it Bella Shmoda or? Christabel. Okpo. And what's your name?
Tommy.
Tommy. If you think that Oluwagbotemi is going to win, make some noise. You get fans, oh. I see all those guys. You're going to be yo. If you think that Bella is going to win, come on, make some noise. You say you get fans. Oh. If you think Tommy will win, make some noise. Yeah? All right, quick one. We don't have any more time to spend. Let's start. Wait. Start again. Be like, I mean, it distracts you. All right. Please celebrate Tommy as she goes back to her seat. Thank you so much. We've got two people standing. One lady standing and one guy standing. If you think that the lady is the one that will win, make some noise. Now you will see something now. If you think that it's the guy that will win, make some noise. All of you on that table. Please, Bella, start. Ladies and gentlemen, we've got our winner. Oluwagbotemi, come on, make some noise. Make some noise. Sorry. And of course, you really tried. The last lady standing. You can go back to your seats. You can go back to your seats. If the governor comes and says we should give you something, we will not hesitate, but I'll collect my course first. All right, ladies and gentlemen, I can say that we're starting straight up right about now. And a program has been sent to me, and we're going to be working with it in due course. Okay, we're going to be starting with the opening prayer. Opening prayer. I don't even know what to call safe. If I shall come and meet you, I beg, just pray. Madam, they pointed to you, but you wait, they point on top person. Yeah, pray.
Let's close our eyes. Father, in Jesus' name. Father, in the mighty name of Jesus. Father, we thank you. We appreciate you for this privilege. We thank you for this beautiful gathering. We thank you for bringing us all here safely in peace and not in pieces. Father, may your name be glorified in the name of Jesus. Father, we thank you for the heart to pray, the mind to seek you, and the authority to bring ourselves into your subjection. Father, may your name be glorified in the name of Jesus. Father, King of will, Lord God, as we are starting, start with us in the name of Jesus. Father, King of will, Lord God, take all the glory. Father, King of will, Lord God, and as we going back, go with us. Let us get back home in peace in Jesus' name. In Jesus' precious mighty name we prayed.
I beg, which church this auntie they go? MFM. Abajono. All right, that was a good one. Quickly, we're going straight to the national anthem. So please, respectfully, can we all be up on our feet as we take the national anthem? Thank you so much. Let's be on our seats. All right. Without any further ado, we're going to be moving straight to the welcome speech. I can categorically tell you that a lot of resources have been put together to put every one of us here this beautiful day. Some logistics have really gone on the way, and I must say that the NIMSA have really, really worked so much. And once again, please put your hands together for NIMSA. I'll bring it up someone who's going to be taking the welcome address and is going to be explaining the essence of our gathering this beautiful morning. If your hands are not too busy, please put your hands together for Tim Tayo Femi Matthew as it comes to enlighten and open the event properly. You can do more than that. Come on, come on, come on. Tim Tayo Femi Matthew.
His Excellency, the Governor, Alhaji Ademola Debussy, here represented, His Excellency Senator Ademola Debussy, gubernatorial candidate of the People's Democratic Party, distinguished guest speakers present, Honorable Commissioner for Health on his way, and respected ladies and gentlemen of the press. This is indeed, time is indeed the revealer of all things, the happy, the blissful, and the grieving moments. But which of the mercies and the benevolence of the Almighty shall we deny? For who would have imagined that an event that started from random conversations between a few individuals on WhatsApp earlier in the year, and which was severely threatened by the ongoing industrial action of the Academic Staff Union of universities, coupled with the corresponding civil unrest and protests that greeted the industrial action across the country, and had us change the venue of this event from Ile-Ife to Osogbo in a short time, would culminate in having well over 1,000 of us gathered under this beautiful hall today. The words elation and overjoyed are grossly inadequate to describe how I feel at this moment to be delivering the welcome remarks on this august occasion, which ticks a lot of boxes of many firsts in the annals of history of our dear state and our country, Nigeria. The first of these firsts is that while the walls of unity and harmony in the health sector of our country is greatly threatened by interprofessional and intrasectoral rifts and crises between different actors of the health sector, this summit introduces us to a new dimension of the future in that it arguably represents the largest coming together of future stakeholders of the health sector with a common goal and purpose. In trying to analyze the impact of the intrasectorial rifts in the health sector, well-meaning Nigerians have pointed out how it hinders healthcare service delivery and patient care, among several others. But today, we are gathered under a single roof to take part in the necessary dialogue that will provide answers to many of the existential crises of the health sector, while also making a very bold statement in unity and solidarity that we have demonstrated. For a moment, take a deep breath and imagine how good it would be if this unity and solidarity would be replicated amongst our elders. That doctors, pharmacists, nurses, medical laboratory scientists, and other healthcare workers and practitioners would work as teammates. That no one would assume the role of a boss and would speak to their colleagues in a demeaning manner. That no one would feel slighted or less of themselves while performing their necessary responsibilities. That everyone would comport themselves and place service delivery over everything else. I am almost 100% sure that sounded very exciting, but probably felt unrealistic. However, I am pleased to announce to you that we have here today students of anatomy, physiology, medical laboratory science, public health technology, pharmacology, human nutrition, dentistry, pharmacy, physiotherapy, occupational therapy, nursing, and clinical sciences, amongst many others. So when next anybody says to you that the intra-professional rifts are beyond solving, tell them about what you are seeing here today. Tell them that if we regularly come together like we are doing today to jointly discuss common issues that we face across respective disciplines, we will be halfway in solving the rates. Tell them this is the way to go. The second of the many firsts is the number of institutions here represented today. For context, the person sitting next to you could be from Obafemi Awolowo University, Ile-Ife. It could be from Obafemi Awolowo University Teaching Hospital School of Nursing, Ile-Ife. It could be from the Seventh-day Adventist School of Nursing, Ile-Ife. It could be from OSUN State University, Osogbo. It could be from Adeleke University, Ede. From Redeemers University, Ede. OSUN State College of Health Technology, Ilesha. Oduduwa University, Kwetumbodu. Or Royal College of Health Technology, Iwo. They might even be from outside of Osun State, perhaps from the University of Ilorin, Kwara State, from the University of Abuja, Olabisi Onabanjo University, in Shagamu in Ogun State, from Ladoke Akintola University of Technology in Ogbomoso, Oyo State, University of Ibadan in Oyo State as well, University of Lagos in Lagos State, Federal University of Technology, Akure, Ondo State, or Adeyemi College of Education, Ondo State. 17 tertiary institutions. Absolutely breathtaking. I could go on and on talking about so many other firsts, but time will not permit. So now to the big question, why are we here? Perhaps the banner behind me gave out our answer, or just maybe the answer to my question have been made available in the flyers that you have seen before coming here today. The OSUN Health Summit 2022 is a thoughtfully sculpted, first-of-its-kind event which provides a forum for youths and young adults like you and I to discuss topical health issues of the state with experienced industry leaders of the health sector. Hence the theme, the health of the state. The summit is targeted at providing solutions to the numerous challenges plaguing the health sector of the state by putting actionable steps forward for both government and non-governmental organizations. And this is why we have invited the finest health and allied health personnel to connect, engage, develop, and share ideas with us on trajectory of common health issues facing the state, its adverse effect on the teeming population and the nation as a whole, as well as how to ameliorate these issues. Hence, this summit will culminate in the release of a final communique, which will provide highlights of policies, plans, projects, and initiatives for the government at all levels to embark on for the fast-tracked growth, development, and betterment of the health sector in Osun State and Nigeria. This communique shall be drawn from discussions made at this summit and in adaptation of the best practices obtainable in other parts of the world. And if properly implemented by the next set of leaders, these policies and projects will make Nigeria the Jerusalem and Mecca of medical pilgrimage in the coming years. Ladies and gentlemen, with a standing ovation and a round of applause, please give yourselves a round of applause for making it down here to this epoch-making event, the first of its kind in the annals of history, the best ever in Nigeria. Give yourself rounds of applause for making it down here. Thank you very much for having me.
That was indeed a beautiful speech, and I will tell you that indeed the finest of the finest speakers and guests have been brought to this place, and I think we're indeed privileged to have some of them here already. I'm going to be doing some recognition of them, and I'll bring some people to this table. And remember, we are youthful, and one thing that characterizes a youthful person is the energy. Is the energy that we should. Let's show them that we have the right kind of energy to dispense. So when I'm going to be calling them, please, for just some more time, you're going to put your hands together for them. And I've got a singular privilege and honor to be recognizing Dr. Subar Kolawole, the Executive Secretary of the Osun State Primary Healthcare Board, ably represented by Dr. Adeola Debussy. You're very much welcome, ma. Please, we want you to please come over to the high table right about now. You can do more than that. So, Anchor, 3 years ago, we're just doing, say hello to the neighbor, you know, greet the person sitting beside you. Ladies and gentlemen, this guy collected the phone number of this lady. Next month is their wedding, and I'm the MC for that wedding. You that you've been shouting God when, this might be the time. Oh. This might be the win. Oh. Sir, do you give us the permission, sir? Eh? Daddy said he has given us the permission. Go on, son. I pray you don't chop breakfast. We're going straight away to the panel session, and want to thank God for the privilege that technology has given to us. We're just going to be maximizing those privileges. It's going to be a virtual session. It's going to be tele-programmed. We're going to be watching them live, and I'm sure the guys behind the logistics, the guys behind, the technology are going to be helping us to set that up right about now. We have a few minutes for that, and just keep rapt attention in case you pick up one or two questions from their session. You can pen it down at the appropriate time. We're going to collate them, see as many as we can answer. And of course, the panelists, and the first person that will be taking the first citation is Adefenyi Esther Joy. Where are you? Please come up quickly to take the citation of Emmanuel Ezenwa. So where is Adefenyi Esther Joy? Where are you? Quickly, we really don't have so much time to spend. All right, she's coming. So as everybody just look back. Who's that guy? And also, Oyekunle Esther should get set as you'll be taking the citation of Dr. Owen Ochayi. So please get set. Come closer so we don't have to wait for you. And also, the third person, Olufunsho Orekoya, please come closer so we don't have to take so much time walking. Thank you.
Good morning, everyone. My name is Adefenyi Esther Joy, and I'll be taking the citation for Emmanuel Ezenwa. Emmanuel Ezenwa, MD, FRSPH, MCAGH, is an experienced public health professional with a demonstrated history of working in HIV/TB program, skilled in entrepreneurial organizations, entrepreneurship, organizational leadership, corporate development, strategy and executive level project management, keen interest in research and data analysis in public health. He currently serves as National Clinical Mentor, National AIDS and STDs Control Program, NASCP, having previously worked in FHI 360 and APIN Public Health Initiatives. He is a fellow, Royal Society for Public Health, member, Canadian Association of Global Health, and he holds a certificate of specialization in biostatistics in public health research from Bloomberg School of Public Health, Johns Hopkins University, USA. With a sounding ovation, can you please welcome Emmanuel Ezenwa?
Thank you so much. So the second citation we're going to be taking, that of Dr. Owen. This is going to be read by Oyekunle Esther. Where is Oyekunle Esther? Okay.
Good morning, ladies and gentlemen. My name is Oyekunle Esther. Okay, I'll be reading the citation for Emmanuel Ezenwa. Okay, I'll be sorry for the mistake. I'm reading citation for Dr. Owen Omojo Ochayi. Dr. Owen Omojo Ochayi is a medical administrator, a health financing expert, and a public health professional with over a decade-long career in medicine and administration. She received her MD degree from the IP Pavlov State Medical University, St. Petersburg, Russia in year 2011. Since then, she has worked as a clinician in several capacities before moving into the health admin space.
Our passion for universal health coverage spurred our decision to attain a master's in public health at the University of Liverpool. Dr. Owen founded HIGC Health Consultants in a bid to provide health financing advisory services to individuals, corporate bodies, and government agencies. HIGC is a premier provider of healthcare administration services in Nigeria and has also diversified its services to include occupational health services, distribution of quality medical equipment and consumables, amongst many others. She's a member of the Commonwealth Scholars and Fellows Alumni of Nigeria COSAN. She's very passionate about mentorship, charity, and giving back. In fact, her entire life's work has been fueled by a strong desire to impact lives and improve healthcare administration in Nigeria as a whole. Thank you very much.
I'm Olufunsho Orekoya, and I'll be reading the citation of Dr. Sanda Ajibola. Dr. Ajibola Sanda is the medical director, New Health, which operates the only fully functional interventional cardiology unit in a public hospital in Nigeria. He is also a senior registrar in the nephrology unit of Lagos State University Teaching Hospital. He currently serves as a senior legislative aide on health to the Speaker of the House of Representatives, Right Honorable Femi Gbajabiamila. He also serves as the chairman, Young Doctors Committee, NMA Lagos. Dr. Sanda was awarded for his outstanding performance as the best doctor for year 2021 in Lagos State University Teaching Hospital. He is a public speaker and a strong believer in the future of Nigeria. Dr. Ajibola Sanda is a happily married man and a father of 2 handsome boys. Thank you.
Thank you. I'm sure our panelists are ready, but before then, there's this amazing individual that has walked into the room also that I would love to recognize. This person is the OSUN Young Progressive Party gubernatorial candidates. That's governorship candidates for the coming election. No other person than Dr. Ademola Bayonle. Where are you, sir? Please celebrate him. You're very much welcome. Please, you're supposed to come up stage. You come up stage. So glad to see that young people are already, joining politics. All right. Panel session straight away. Permit me to please be seated here so I can see the screen, because I will be moderating this panel session. Can our speakers hear me? Please, if you can unmute your mics and say hello.
Can you hear me? Hello?
Yeah, thank you. I want to guess that is Dr. Owen, right?
Yes.
Thank you
Correct.
so much. Thank you so much. Can Emmanuel Ozenwa also please, say something, unmute your mic so we're sure that you're with us. Are you there, sir? Dr. Sanda Ajibola, can you unmute your mic? Technical team, are we together? We're together. So it's from them, not from us. Oh, okay. Ladies and gentlemen, once again, we're going straight up to the panel session. And we're going to be talking about the health management, infrastructure, administration, and systems. And I'm going to be doing a brief overview. In October 2014, the National Assembly enacted an act that attempted to provide a framework for the regulation, development, and management of health systems and set boundaries for rendering health services in Nigeria, called the National Health Act 2014. In the bid to provide an operational platform for the National Health Act 2014, the National Health Policy 2016 was developed. In attempts to establish solid and evidence-based mechanisms and directions for Nigeria to significantly improve the health status of all its citizens to enable fully healthy and fulfilling lives. The policy is geared towards ensuring that Nigeria successfully implements current national and global priorities such as the Sustainable Developmental Goals, such as the Universal Health Coverage and Vision 2020. All right, so
basically to support people that are taking drugs or people that are living with HIV and those are.
okay. So I'm going to be directing this question to Dr. Owen Ochayi right about now. Factors that cause the wide gap in doctor-to-patient ratio, which is currently at 1 to 6,000 in Nigeria, an important topic that was not addressed in the national health policy. So what do you think, can contribute to all of that? 1 to 6,000 is so numerous, and I can say emphatically that medical professionals are overworked. And I'm not sure that we would be able to get the best out of these people. So please, what are your views as regards this?
Okay, so obviously the gap. First of all, let me say good morning. Good morning to everyone. It's nice to be joining you guys virtually. Unfortunately, I couldn't be there physically. But to your question, there's a palpable and an obvious gap in terms of, doctor to patient ratio. The first thing can be attributed to, of course, brain drain, migration. We have several thousands of doctors, migrating to the UK, the US, Canada, even Kenya, Nairobi, and other African countries for, of course, better pay, better staff satisfaction, better benefits, better quality of life in general. And I think that's the core of the problem. Of course, there are other issues like insecurity, because when you talk about universal health coverage or you talk about health policies and things like that, the bedrock is primary health care, right? So, in order for us to even start the discussion of universal health coverage, you have to talk about primary health care. And a lot of the primary healthcare centers are located in rural areas, and things like that. And unfortunately, with the issues of insecurity, kidnapping and things like that, you have medical doctors and other medical professionals who don't want to go to these rural areas and things like that. And much of the funds that allocated to healthcare in Nigeria is then being diverted to tertiary institutions which are located in the urban areas, and things like that. So we don't have, the system is built in such a way that it fails ultimately. It's not a working system that encourages, first of all, your medical professionals to want to stay. In terms of remuneration, you hear about industrial action, strikes here and there, and things like that. So obviously, because of that, you would have medical professionals who don't want to go and work in government institutions, especially primary health centers. And then you also have doctors who are migrating and, relocating and all of that. Resource allocation is another problem. You don't have the necessary resources allocated to the health sector in general, just generally speaking. And then you have doctors who are now becoming tailors. I mean, I'm all for diversification. I think variety is the spice of life, right? However, I mean, if you've gone to medical school for 6-7 years and in the Nigerian system can you guys hear me? I just want to be sure I'm not.
Yes, we can hear you, ma.
Okay. How many minutes do I have to answer the question? I tend to.
Yeah, please just round off. Just round off because there are a lineup of questions already, ma. So, but I'm going to just be going through all.
So basically, migration, insecurity, resource allocation, I'd say are the major issues when it comes to the doctor-patient ratio.
Thank you so much. Please put your hands together for R. Now, Section 2B of the 2014 National Health Act empowered the Federal Ministry of Health with the power to prepare an annual budget accordingly for strategic implementation of plans for the country's health, while less than 6% of these annual budgets goes to the sector. Now, I understand that you are an expert in health and administration. What do you think is the role of hospital management and administration in ensuring that this kind of problem can be gapped, can be fixed, Dr. Owen, before I leave you, ma?
Oh, okay. The question was for me. I thought it was for him. Sorry, please repeat the question.
Okay.
I thought it was for Onyeka.
Yeah, because I know that you are an health and administration expert. I said that section. Ma?
Self-acclaimed.
Oh, okay. Section 2B of the 2014 National Health Act empowered the Federal Ministry of Health with the power to prepare an annual budget accordingly for strategic implementation of plans for the country's health, while less than 6% of the annual budget goes to the sector. So, what are the factors that influence strategic implementation to budget allocation ratio, especially in our hospital management boards and, administration?
I mean, basically, I'd say, at the policy level, obviously, it has to do with the decision maker, so to speak. So if you do not have a good representation of, say, medical doctors or medical professionals who are directly affected by this, who understand how the system or how these policies affect the health workers, if we don't have that representation in the House of Assembly, or if, sorry?
Please go on, ma. Go on.
Okay, if you don't have that representation, with the powers that be, so to speak, or with the National Assembly, House of Representatives and all of that, unfortunately, your point of view will tends to get lost, in the whole discourse, So when you have people who have not experienced this, making these decisions, these budgetary decisions, budgetary allocations, unfortunately, this is what we get. Of course, even with the linear budget that we do have, there's still the issue of, the money the budget may not be sufficient. However, with the budget that we do have, what have we done with it? I think this is where we should, before you start to advocate for, increased budgetary allocation, you need to, first of all, talk about what we have, what have we done with it, what can we do with what we have, and unfortunately, because of issues of corruption, things like that, issues of enforcement. So that you have allocated X amount of money to tertiary institutions, but there's nobody going around doing inspections. There's nobody going around ensuring that these funds are actually being used for the purpose for which it was catered for. So these are the issues, corruption, before we even start to talk about increased allocation, I think what we need to do is focus on enforcement, focus on proper use of the resources that are allocated, and avoid wastage and things like that.
Thank you so much. Thank you so much. Now, I'm going to be directing this to Dr. Emmanuel Ezenwa because, yeah, you have special interest in public health, and I'm sure this would really interest you. Now, the lack of competent health administrators as a basic factor in the drastic decline of the country since the colonial system's disappearance. Now, public health is one thing that cannot be overemphasized. We just left the outbreak of the pandemic, COVID. The world is talking about monkeypox just right about now. And, how do you think that there should be a better collaboration between health administrators and those that are providing the clinical service to the end users, that's the public?
So, good morning. I don't know if you could hear me.
Yes, we can hear you.
Okay, thank you so much. So, first of all, I want to correct the impression that we do not have competent people as health administrators. We actually do have a lot of people. This particular subject is very dear to me, considering the fact that for us in public health, we've really tried as much as possible to increase the collaboration between the clinicians and the health administrators. But it's also very important that we look at the fact that in as much as we've had colonial people who managed well, we couldn't assess them. But in a fast-changing world, we can't say that Nigeria has a lot of health administrators who are equally capable. But then there are three things we need to do. The first is to get them into the right place, make sure that the right people are handling that particular position. And then the second thing we need to do is that we have to find a way to benchmark, have a forum for interaction. So let's say you're an administrator and you're running a hospital. As with every single thing we have to do in management, you have to find a particular interval in which you sit down with the clinicians and the administrator. Have a one-on-one session. It could be weekly, it could be monthly. I've seen administrators do what they call an audit round, where they have a time where they meet with the clinicians and see where they come in. Is there something we have to provide? Do we need to improve care? Do we need to improve health resources? And that still brings us back to the building blocks of WHO building blocks of health system strengthening, where you have to look at the health resources, leadership and organization, health informatics. So you use all this data, you compute all this data, and you sit down with the clinician and ask them, what do you want? Where do we come in? How do we make it better? We have to ask these questions. So if you want to improve the better collaboration between the clinicians and the administrators, like I said before, you have to have a sit down, and it has to be regular. It has these interactions and these moments where you rub off on this communication and eliminate the communication gap, that you get to see what really is the problem and how we can improve efficiency. It's just a management skill, and I think we have a lot of people that are capable enough to get it done. All
right, sir, before you leave that question, sir, because I see that you are a national clinical mentor, National AIDS and STDs Control Program.
Yes, I'm one. Yes.
Do you think that we are doing enough with everything that you've explained? What are the measures that you think are expected to be put in place that we are doing? If you can just shed some light on that.
Okay, so if we're actually doing enough, I don't think I'll be here sitting down trying to explain why we should do it. But the truth is, we can actually do better. I don't want to dwell on why you are not doing well, but I think we can do better. Some people have made the attempts to improve. What are we not doing well? Like I said earlier before, we have to look at the 6 building blocks of health system strengthening. Do we have adequate budgeting? Do we have adequate resources? Do we have the service delivery optimal? Do we have a close collaboration between the clinician and administrators? And just like the previous speaker panelist said, budget is very, very important. We should have at least 25% of it of our budget going to healthcare. We don't have that. Universal access to healthcare. So, are we doing enough? No. Can we do better? Yes. Are some people trying to do? Yes. So we can't totally condemn this system in terms of saying that we are not doing enough. We are actually, but then this is a systemic change. But there must be an intentional approach towards improving the system. And to do that, you have to have a roadmap, follow it, and sustain it. And we have to have government backing and political will to make sure that we sustain this roadmap. Whatever has been done in terms of healthcare coverage, improvement, and strengthening of health system in Nigeria, they've all been good. The problem has been, can we sustain it? Another government comes, they change it, another one comes in, they tweak something. So you just discard it. And each time these systems and these projects remain at the building stages. So we could improve in terms of what we are doing by checking out continued accountability and sustainability and budgeting. Once we put these systems in place, monitor and evaluate what we are doing, then we can tweak them along the way. I'm sure we are going to do very well if we do these things.
Ladies and gentlemen, please put your hands together for Dr. Emmanuel Ezenwa. Now, moving over to Dr. Sonda Ajibola, I see that you are a senior registrar from the prestigious Lagos State University Teaching Hospital in nephrology. And I'm going to be directing this question to you. The 2014 National Health Act did not clearly and appropriately share responsibilities among primary, secondary, and tertiary healthcare institutions. We see that sometimes people with things like malaria, they just go to the tertiary institution, when we know that at times primary healthcare centers can handle all of these things. But because there's no proper alienation, there's no clear-cut spelled out roles in the 2014 Act on responsibilities among primary, secondary, and tertiary healthcare institutions. So what do you think, sir, as regards all of these, issues that might come up, when there's a mix-up as such? Dr. Sonda. Dr. Sonda, we can't hear you, sir. No, we can't hear you. I can read your lips, so it's not like, how are you hearing what I'm saying? No, I'm only reading your lips, sir. Are you sure your mic is unmuted? Unfortunately, we can't hear you. Okay, I think he said he was going to leave and join back. So we are going to be moving on. I'm going to reserve that question for him. Okay, now let me quickly go back to Dr. Emmanuel. There's this question I'm sure that would fascinate your interest. No available acts on the training and retraining and retaining of health professionals and auxiliary primary healthcare workers in the country. What do you think, sir, are the brunts that we have to bear, and how do you think we can overcome, issues that come up from this? Dr. Emmanuel. Can you hear me? Can Dr. Owen hear me? Can any of our panelists hear me?
Yeah, I think we are muted for quite a while, so we just got caught up with the technical. So I think when we want to speak, the technician could just hear us, just let us speak. So I think you may have to repeat the question so that we could just flow.
Okay.
Thank you.
Thank you. So the question was, there is no available act on the training and retraining and retaining of health professionals and auxiliary primary healthcare workers in the country. And I'm sure that there are a lot of issues that would have come up from that. We've been bearing such burdens. So what do you think, measures that we can put in place to forestall issues like that? And I think I'm also told to inform that for each question, we shouldn't spend more than 2 minutes so that we can maximize the time that we have. So I hope you got that, sir.
Thank you so much for your question, but I think as a matter of emergency, we may need to convene the relevant stakeholders in terms of training. So there are a lot of training colleges and medical colleges, both for the nurses, the doctors, and other auxiliary healthcare and paramedical healthcare workers in the system. These things are existing. been very good with training our healthcare workers. So as evidenced by the fact that we have foreigners come here and then pick a lot of doctors, nurses, and paramedics to come and work in their own countries. The simple thing I think we need to do is, like you said, improve the quality of the training, retraining. That has been done. But then the issue of retaining is where we have to come in. Why are we losing doctors every day? If you check the GMC registers, we have over like thousands of Nigerian doctors working. Not because, so it means if the Nigerian doctor can move from here to the other end, it means the quality of the training is almost at par, because they write these exams, they pass them, they do the interviews, and they even get retained where they work. So something is wrong and fundamentally wrong with the system. And that's where we have to look at the issue of budgeting, funding, and continuous improvement of the quality of training. Now, aside training doctors, we also need to make sure that and how do you retain them? Make sure the environment is good, they have good work, they have the tools to work with, they have a good working environment, and they are paid adequately with their peers. And not just about paying them, also improve the system. You can pay a doctor how many amounts of money you want to pay them, but if they don't have things to work with, they come in, their patients can't even access the healthcare. You know what to do, but even when you offer it to the patient cannot do that. So this is a systemic change. Like I said, I keep referring, we have to go back, looking at the 6 building blocks of WHO, adopt those strategies, benchmark them, and monitor them. I think this is what we need to do in terms of training, retraining, and retaining of healthcare professionals.
Thank you so much. Now, let me direct this to Dr. Owen, because we just talked about budgeting. And please, once Dr. Sunda gets back to us, please just alert me so that I can get to you with a question that has been assigned to you. So, Dr. Owen Ma, the 2016 National Health Policy emphasizes advocates for increased budgetary allocation to health at all levels, which saw an increase from 3.73% in 2016 to 4.15% in 2017. But the advocacy has not been great enough for a marginal increase in budgetary allocation of funds in Nigeria compared to world-class standard. And in fact, if you want to look at the increase just from 3.73 to 4.15, I'm not sure that's enough. But then, even with that increase, there's no marginal, increase in the funds that are allocated into that. So what are your views about this? How can we get a little better? Dr. Owen.
Okay, thanks for that question. That's a loaded question. You can't talk about budget without talking about the economy. We are in an economic recession, and we've probably been in an economic recession for the past couple of years. Right? Unfortunately, that's the situation that we find ourselves. So when you have such an infinitesimal increase from 3.73 to 4.15%, number one, you're not going to see much difference clearly, as we have seen. And then number two, it's only going to get worse. I mean, even if it's increased to 6%, you understand that our economy is largely importation based, right? So we don't do any exportation. Unfortunately, we rely so much on FX, as a country, and we know what FX is now. So unfortunately, it's only going to get worse until the economy improves. How do we go about that? That's what we should be looking at. What are the things that we can do to improve the economy, right? I had written something down, and I don't know if I'll have the opportunity again, so I really do want to talk about this. Financial inclusion. The economy of any country is largely driven by entrepreneurs, driven by small and medium enterprises and things like that. But unfortunately, we don't have the principle of financial inclusion is practically non-existent in Nigeria. Try as an entrepreneur to get a loan or to get investors, to get some sort of assistance with your bank, right? It's going to be, in fact, it's going to be like passing an elephant, like trying to get an elephant through the eye of a needle. So there's no financial inclusion, first of all. So if there's a country that lacks financial inclusion, unfortunately, will continue to have a dwindling economy. And if the economy does not improve, budgetary allocation, no matter how much they increase the budgetary allocation, because obviously we're not going to get to a position where budgetary allocation is 30%, or 35%, right? But even at that, if the economy continues to go down, if we continue to remain in an economic recession, we're not going to feel the impact of whatever budget is allocated to the healthcare sector. And even with that, like I mentioned before, of course, again, accountability, transparency, and, avoiding or trying to mitigate issues of corruption and resource allocation and things like that. However, I really want to stress on financial inclusion. I think that's the bedrock. That should be the bedrock of our discussions in terms of that, because you can't talk about budgetary allocation without talking about the general situation of the economy in the country.
Thank you so much, Ma. Thank you so much. I really wish that Dr. Sonda is here, because something interesting about him is that he's a legislative aide on health to the Speaker of the House of Representatives, and there are some questions as regards legislation that I would have loved to ask him. But, as we move on, I quickly would want to observe a very important protocol. Ladies and gentlemen, we are so privileged to have the Executive Governor of the State of OSUN in our midst, ably represented by the Honorable Commissioner for Health, no other person than Dr. Rafiu Isamotu. Please put your hands together for the Honorable Commissioner for Health representing the Governor. And sir, please, we need you to come up to this seat that has been reserved for you. If you want to clap, I believe you can do that better. I just remember one dream that I had. I had a dream overnight, and ladies and gentlemen, my dream used to come true. I dreamt that the Honorable Commissioner for Health to represent the Governor. Number one, you see, it's coming true. And the second one was that I dreamt that he had over 500,000 naira to me. I'm sure that that one too will come true. Somebody say amen. Sir, my dreams used to come true. Yeah? Okay, we'll see after that. All right. Ladies and gentlemen, I'm going to the final round of questions for our panelists who are actively with us virtually. And what are your assessments of state enactments of mirroring laws of National Health Act and adoption of the National Health Policy? I'll take that again. What are your thoughts as regards the assessment of state enactments of mirroring laws of National Health Act and adoption of the National Health Policy? That's evidently will be directed to, our panelists that are with us. Just let me go to Dr. Emmanuel first. We have Dr. Owen. Then if possible, if Dr. Sonda is still with us, we're going to hear from him. Okay, I'm going to take the question again. And the question is, what are your thoughts as regards the assessment of state enactment of mirroring laws of National Health Act and adoption of the National Health Policy? It seems so compacted. It's Temitayo that puts those grammar together for me. So, well, basically, okay, our panelists still there? Are they still there? Okay. So Dr. Owen, Dr. Emmanuel, one of you can go first, and if possible, Dr. Sonda.
Okay. So the assessment. Let's look at. I wish this was more of an interactive session, but let's look at the states that are actually trying to. I would focus on universal health coverage. I don't have. You've given me only 2 minutes to speak, and I'll focus on universal health coverage because that's where my passion lies. Lagos State, Lagos State Health Insurance Scheme. Lagos State is doing quite a lot. Not enough, obviously, but they're doing something. Calabar, Cross River State, they're also doing something in terms of universal health coverage. I'm sorry, I'm not very familiar, and that's very bad of me. I'm actually going to read more about OSUN State and what they're doing in the universal health coverage space. Edo State, I'm proudly from Edo State. Unfortunately, yes, we did start our own health insurance program. I was a technical advisor. Well, HIGC was a technical advisor to the program. Unfortunately, we've had some hiccups along the way. But I think that the state government, of course, like I said before, primary health, which of course is majorly controlled by the local government, tier of government, and it's the bedrock of attaining universal health coverage. However, of course, you need health insurance in order to bridge that gap. Primary health center, like, you know, it's a primary health center, it's not a secondary or a tertiary, so they have limits to what they can do in terms of helping patients out health-wise, and preferring solutions to health problems and things like that. However, that is the starting point. I already highlighted the issues with the primary health centers earlier, but then moving on again, budgetary allocations, and PPPs. I didn't get the opportunity to talk about PPPs, but PPPs, I think, would also help to drive this initiative of what the national health policy aims to accomplish on a state level. I think a few state governments.
Sorry, Dr. Owen.
Foresight.
Just a second. Just a second. Dr. Ogini, who is here, is an expert in that field, and he just wants to share some light. So just some seconds.
Oh yes, please. Yes, please.
Thank you,
go ahead.
Dr.
Thank
Owen.
you.
I'm so glad listening to you. I am the chairman of the Forum of Chief Executive Officers of all state social health insurance agencies in Nigeria. And I'm quite glad you were talking about Lagos, Edo, and Cross River State. I coordinate all of the state social health insurance agencies in the country. The question here is that of how have we been able to successfully domesticate the National Health Act 2014 at the state level. And I hear you, the last page, we were talking about national health insurance. And we know that National Health Act 2014 in Section 11 established the Basic Healthcare Provision Fund, and it made it mandatory for every state in the country that wants to access the Basic Healthcare Provision Fund, which is actually the first attempt of Nigeria to earmark for health, aside from all of the other budgetary allocations at the state level, which is meant to be the state equity. The Basic Healthcare Provision Fund has become a driver for all states to establish their own state social health insurance agencies, as well as ensure that they have a functional state primary healthcare development agency. Now, to that extent, in this state, this country as of today, it is only Akwa Ibom State and Rivers State that have not established a functional health insurance agency. All other states in Nigeria have a functional health insurance agency. Some of them are driven solely by the Basic Healthcare Provision Fund. Some of the state governments have not begun to make allocations and releases to ensure that there is state equity to support the fund that is gotten from the federal government under the Basic Healthcare Provision Fund. And the good news now is that just last week, the president signed into law the National Health Insurance Authority Bill. This bill ensures that 830 million Nigerians are going to come into the health insurance net. And it made health insurance mandatory for everybody that lives in Nigeria. To this extent, we are going to see a lot of funds coming into the sector, particularly at the demand side, which health insurance represents. And then we will now need to work on the supply side, where we have the primary health centers that will be required to build capacity to be able to take care of the over 830 million people that are coming to access care. Essentially, these are vulnerable people who, for many years, have not been able to get to access care because they don't have the means. They're either geographically not able to access care, or they are financially or economically unable to access care. These are the two barriers that keep people away from healthcare services. So the question he asked about, how do we get the states domesticating this provision of the National Health Act 2014 such that we can have better public health service delivery at the state level? This is what has been going on already at the moment, all of them. We're going to have a meeting of the forum again next week, and then we're going to be talking about the status of implementation of state health insurance. You recollect that in 2015, the National Health Insurance Scheme took a bill to the National Council on Health seeking the decentralization of the scheme, because having operated between 1999 and 2015, they had not even achieved up to 5% coverage of Nigerians. It was an abysmal performance. And by 2017, again, this bill was presented at, the memo was presented at National Council on Health, and it was ratified. And that was what began, together with the appropriation of basic healthcare provision form for the first time in Nigeria in 2018. Even though the National Health Act has existed since 2014, it was in 2018, through the efforts of Senator Lanre Tejuosho and the current distinguished Senator Ibrahim Oloriegbe, who is the chairman of the Joint National Assembly Committees on Health. These two were vibrant in pushing for the release, for the appropriation first of this fund. And so Nigeria, for the first time, got 64.5 billion allocated for basic healthcare provision fund. And all states started scampering to establish their own health insurance agencies. In Osun State here, we are well advanced. Our governor in Osun State had released about ₦500 million ever before the basic healthcare provision fund ever came to, even to being. I think you need to give a round of applause to that. Because 477 million naira was released, and we captured over 75,000 vulnerable people who are currently receiving care. Many of them have had very complex operations done, even including orthopedic surgeries done without they having to pay a kobo. So Osun State had advanced a lot in caring for the vulnerable, even before the Basic Care Provision Fund was released. And we are still going ahead in all of this. So states are doing quite a lot in ensuring that they key in to the provisions of National Health Act 2014. It's all across the country. Only 2 states are left at the moment. I know Rivers State, they have enacted their laws, but they have not put in place the structures for the operations. Akwa Ibom State has not done anything at all. But other states are moving, and they have different levels of coverage. Thank you.
Please put your hands together for Dr. Adeni Ogini. Thank you so much. And I'm sure that Dr. Owentu, that resonated with your thoughts. But because of time constraints, I was just informed now that Dr. Sonda Ajibola is back with us. So please, I'm just going to be directing the very last question to him, then we'll move on straight away. So, Dr. Sonda, are you with us now, sir?
Yes, I am.
Thank you so much. So it's interesting to know that you're a senior legislative aide to the Honorable Speaker, Federal House of Representatives, and someone who works in a tertiary healthcare system. Please, the 2014 National Health Act did not clearly and appropriately share responsibilities among primary, secondary, and tertiary healthcare institutions. So, marrying both responsibilities, or all of the responsibilities that you hold right now, what do you think these challenges have posed to us, and how do you think, we can do better with this act, the 2014 National Health Act? Thank you.
Yeah, I want to apologize for my network initially. I don't know why you couldn't hear me, but I can hear you loud and clear. And I want to greet everybody who has contributed and been a part of this discussion. So the issues that we have, first of all, is we need to decentralize, just like government itself. Health in its own sense needs to be decentralized. And taking a cue from the last speaker, now that a lot of state governments have started to implement their own form of state health insurance, I'm very conversant with the Lagos State model, because I'm an enrollee of the Lagos State Health Insurance Scheme. I would say the burden on tertiary healthcare institutions is starting to reduce. First of all, Nigeria needs to really invest in our primary healthcare system, as that will be the foundation to solving 90% of our healthcare challenges. And we would reduce the unnecessary burden on secondary and tertiary healthcare institutions vis-a-vis presentation. So the 2014 National Health Act needs to still be looked into. A lot of improvements vis-a-vis decentralizing of the healthcare from the national body and giving autonomy to states, more autonomy to state health institutions and state governments to control their healthcare resources. And I think then we can now have proper management of what is already being allocated to different bodies. Thank you.
Check. Okay. Thank you so much, Dr. Sonda. And okay, yes, so Dr. Ogene wants to make a comment on what Dr. Sonda said.
Sorry, I'm talking from the point of being a service provider myself, a clinician, and of course being a public health physician and an academic. 33 years I've been in medical practice in this country. It is not the law that has a problem. Nigeria National Health Policy states that health will be provided for the people of this country at 3 levels: primary, secondary, and tertiary. Now, primary cases have no business going into tertiary institutions at all. But the problem is with the implementers. The law doesn't have any fault. But those of us who run the system, particularly at the tertiary and at the primary centers. The primary centers are empowered by the local government. It's the local government that actually runs the primary health centers. Now, in some of the states, state government and local government have come together to run and administer primary health care services. Now, in these states, if those primary health centers are given capacity in terms of manpower, in terms of infrastructure and equipment, and in terms of medicines and supplies, to take care of the conditions that come to the primary center, nobody will move from primary center to tertiary center with primary conditions. That is one. Number two, at the tertiary institutions themselves, particularly with the advent of health insurance in Nigeria, most of the tertiary institutions are accredited for primary service delivery. And this is an anomaly. I was at a very high-level meeting with the chairman of CMDs in the country and the chairman of honorable commissioners. We were there together, about 18 of us. And I told them that there is no business that the teaching hospital has having accreditation for primary care in a system where the national health policy is clearly stating that primary care will go, primary conditions will go primary care level at the primary health care centers and secondary and then tertiary. But because it is not working the way it should work, so we as the clinicians, we also as the health administrators must begin to insist that primary cases are seen at the primary care level. And we begin to restructure our system, the public health delivery infrastructure, to answer to the needs of those primary conditions at the primary level. Then we are going to referral system in Nigeria to be very effective and efficient. Thank you very much.
If you want to clap, you should do that better. Thank you so much. And it's on these notes, do I gladly inform you that we're rounding off the panel session. So once again, please put your hands together for all our panelists, Dr. Emmanuel Ezenwa, Dr. Owen Ochaye, and Dr. Sonda Ajibola. Thank you so much. We honestly appreciate you. All right, ladies and gentlemen, we really don't have so much more time to spend, but there are some persons that walked in while the event was going on, and I'm so glad to announce to you that the founder and CEO of Onguvi Health LLC is with us, and of course, Onguvi is also a major partner. Please put your hands together for Mr. Joshua Koya. And he was flanked by our very own Adeoluwa Olowokere, All right, so please, I've been informed that Mr. Joshua Koya should please come up, to this table right about now. And I also see that we have in our midst the CEO of VARCE, Mr. Ademola Debussy. Where are you, sir? Mr. Ademola Debussy. You're very much welcome. Please come up to this table also, to be seated. Thank you so much. I'm so glad to announce to you that the medical director of Oshogbo Central Hospital is also in our midst. Dr. Ajayi, where are you, sir? Please put your hands together for him as he also comes up to this place. So right about now, we're going to the guest speech without any further ado. We're so privileged to have, the executive governor of the state of Osun in our midst, ably represented by the Honorable Commissioner for Health, State of Osun. He's going to be coming up right about now to give his remark, and with a resounding ovation, welcome with me, Dr. Rafiu Isamoto. If the people on the high table are standing,
please sit down. We give glory to God Almighty for making today a success. While we appreciate God, we need to appreciate those whom God had chosen to administer on this space. I would like to begin by recognizing my own, Dr. Niyi Ogeni, Executive Secretary of our OSUN Health Insurance Scheme, Insurance Agency. Dr. Ogeni, you are doing well. I would like to recognize Dr. Ademola Debussy, OSUN YPP gubernatorial candidate. I recognize you. Thank you so much. I recognize Mr. Joshua Koya. You're welcome. We're also recognizing Mr. Ademola Debussy. Thank you so much. Thanks for coming. Mr. Debussy Abdullahi, representing Mediplan HMO. You're welcome. Dr. Adeola Adeniwale. That's my own. She's my own too. The last but not the least, pharmacist Fasanu Luafumilayo. Thank you so much. I recognize all the doctors seated here. Before I read Mr. Governor's speech, we are all doctors. We are colleagues. Perhaps some of you know Professor Tolu Odugbemi. He was our provost at the College of Medicine, University of Lagos, where I trained. He subsequently became the Vice Chancellor of the University of Lagos. He's a professor of medical microbiology. In his class, in Idiaraba, all those at part 2, he will point at you and say, "Doctor, answer the question." And you'll be wondering, how can somebody call me a doctor when I'm still learning microbiology and all that? So I believe all of you seated here, you are all doctors by the grace of God. The head of the state consolidating on the gains of the past and charting the course for the future. This is a paper delivered by Mr. Governor of the state of Osun, Mr. Adebola at OSUN HEALTH SUMMIT, organized by the Nigerian Medical Students Association, held on Wednesday, 25th of May, 2022. I am delighted to be invited as the guest speaker to join you in this epochal occasion of the 2022 OSUN HEALTH Summit, organized by this premier organization and one of Africa's most vibrant and forward-looking student organizations, the Nigerian Medical Students Association. I must particularly commend the leadership of this organization and its members for facilitating this timely event as a platform for discussing topical issues germane to the provision of qualitative, accessible, and affordable healthcare for the teeming citizens of our country. I am particularly enthused by the excellent choice you have made in the theme of this summit, which is the head of the state consolidating on the gains of the past and charting course for the future, as it projects this organization as being truly professional and visionary. For us as an administration, that is proactive, that is passionate, and indeed modestly reputed for its aggressive commitment to the transformation of the health sector. Your team holds a fascinating interest. This is because it will provide an opportunity to draw from our peculiar experience as a state, while also sharing relevant insights that may be helpful in collectively charting a course for the future. As an administration that is looking at the big picture, we take liberty to look at the theme of this summit, Beyond Health, to see the health of the state as encompassing its overall well-being in all sectors, as well as we have aptly captured in our development agenda, and to see health as the plank upon which the total vibrancy of the state rests. This is even more so that health, as it is generally known, is wealth. Health is the basis and indeed the sole determinant for the prosperity of any nation. No nation, however endowed, can make any significant progress without prioritizing the health and well-being of its citizens, which, as we know, is the greatest asset of any society. In this paper, I intend to speak briefly on the state of the healthcare in our nation, draw relevant examples from our ongoing strategic reforms and interventions in the health sector, its gains, while sharing thoughts on what we all must commit to doing in ensuring that we must meet our developmental aspirations, especially with regard to the provision of functional and qualitative health care to our people. Nigeria and qualitative health care challenge. Almost 62 years after independence in 1960, Nigeria has continued to grapple with the provision of qualitative health care to our citizens. Since independence, the country has implemented a number of health reforms and policies to improve the quality of health care in the country. However, some of these policies are either misplaced or partially implemented. Consequently, health infrastructure continues to deteriorate, and financing the health sector has become a knotty development issue. While successive governments have made concerted efforts to promote equity and ensure unrestrained access to health services, often with varying degrees of successes, evidence abounds that many citizens still have difficulties accessing affordable and qualitative health care. Also, worthy of note is the fact that over the years, governments at the federal and state levels have focused more on secondary and tertiary healthcare systems development, with little attention devoted to the provision of quality primary healthcare services to the most vulnerable groups, that is, women and children, especially those in the rural areas. The result of this malign priority is evident in the poor showing of the country in key health outcomes. A telling pointer to this fact is provided by the 2018 Nigeria Demographic and Health Survey report, reflecting the challenges of the health sector in Nigeria. According to the report, maternal mortality in Nigeria still ranks amongst the highest in the world and is put at 502 deaths per 100,000 live births. Also, infant mortality rate was 67 deaths per 1,000 live births, while under 5 mortality was 132 per 1,000 live births. This implied that more than 1 in 8 children in Nigeria die before their 5th birthday. Furthermore, the average life expectancy of Nigerians is estimated by World Bank in 2018 to be 54 years, with women and men having life expectancy of 55 and 53 respectively. These gloomy health indicators, among others, call for serious attention and other health sector and stakeholders in the country to creatively develop solutions that would respond appropriately to these healthcare issues. Our experience in OSUN and the emerging equitable gains have proved that it is possible to chart a new course for health system going forward. However, This can only happen with the right political will and the determination to do what is right. Gains from healthcare reforms in OSUN. In line with the truism that health is wealth, our administration regards wealth as the foundation of effective people-oriented governance. Consequently, we put into the front burner and ensure that none of our people is left behind in accessing adequate, equitable, and qualitative health care. We conceive health not as health for its own sake, but for the overall development of the state and the people. Consequently, we regard health as a tool for the overall well-being and welfare of our people, the growth of trade and the economy, and the provision of infrastructure and sustainable development. Within 3 months of assuming office in 2018, we commenced a massive revitalization program of our health sector, which includes the revitalization of 332 primary care centers, 1 per ward, across the state and our 9 state hospitals, in line with our resolve to take health care to every home. More than 300 of these primary care centers have so far been completed and are operational across the state. Work is at various stages of the completion on the remaining ones. Additionally, we began the renovation and revitalization of the 9 state hospitals with construction of 120-bed ward at the State Specialist Hospital, Trauma Center, New Theatre Complex, Children Ward, Main Laboratory, Blood Bank Building, and Surgical Ward at the State Specialist Hospital, Asubiaro, among others. These proactive measures came in handy when the coronavirus pandemic broke out in 2020, as the facilities were used to treat patients. We have been unrelenting in our sensitization and empowerment efforts to ensure efficient management of COVID-19 pandemic. For effective provision of palliative during the COVID-19 lockdown, we set up a 21-man member food and relief committee consisting well-meaning citizens of the state, in addition to government intervention, to source for food for our citizens in their need of food during the lockdown, using the World Bank Social Registrar 70% and locally generated registrar 30%. We have engineered the OSUN Health Insurance Scheme with a view to boosting citizens' access to better health care. To demonstrate this commitment, we released the sum of 150 million naira as take-off grant for the agency and overall 477 million naira as equity grants meant for the premium for the poor, the needy, and the vulnerable within our first year in office. About 300,000 residents are already enrolled on the state social health insurance scheme, and 195,565 are successfully enrolled and accessing care under the scheme. We are proud of the scheme as one of the leading state health insurance agencies in the country. We are #1 in the Southwest. To further strengthen the scheme, we have consistently paid the government share of the public servant health insurance premium, which is 3% of workers' basic salary, and the equity grant meant for the provision of treatment and care for the vulnerable and the less privileged in the state, including the aged 65 years and above, children under 5 years of age, pregnant women, and people living with disabilities, free of charge, making us the second in the entire federation to do so. In recognition of our intervention, the United States Agency for International Development, USAID, selected OSUN Health Insurance Scheme, OIS, for piloting the integration of tuberculosis with state social health insurance scheme in Nigeria, in collaboration with their consultant at Equitable Health Access Initiative. The programs have just been completed, and the enrolled patients are already receiving treatment for TB across the state as part of the OIS Equity Program for vulnerable patients. We also established the OIS Drug Distribution Center, which is now supplying medicines and consumables to 16 OIS accredited government secondary health facilities across the state to put an end to the perennial out-of-stock syndrome of medicines in government secondary health care facilities for health insurance enrollees. In line with our plan to provide adequate welfare to our staff, we have fully implemented the revised Consolidated Medical Salary Structure, COMES, and Consolidated Health Worker Salary Structure, CONHES, for healthcare workers in our state. In view of the complementary role of food to health delivery, we instituted the flagship OSUN Food Support Scheme, which supports 30,000 vulnerable persons in our state on a monthly basis. We also sustain the free meal program for elementary school pupils to enhance their nutritional and mental capacities. We shall be rolling out other support programs soon for the elderly and widows in our dear state. All these concerted efforts in the state health sector are already yielding fruit, especially considering that confidence in the public health facilities in the state has been largely restored. In addition to an improvement in the number of patients who seek health care in these facilities, the state is also recording decline in the rate of maternal and infant mortalities, among other indicators. In recognition of our sterling performance in the health sector, I was selected for decoration as Ambassador for Better Health at the Universal Health Coverage Summit, organized by the Universal Health Coverage 2023 Forum in collaboration with Chatham House, London, which held at the Yaradua International Conference Center, Abuja. Our strength lies in our large political will and our ability to rally our partners and donors, engagement in diversification of the state economy, and prudent management of the resources of the state to deliver the health care that our people desire and deserve. The above interventions are the outcomes of our policy, strategy, and leadership as contained in our development agenda, which we implemented with rigor and tenacity, charting a course for the future. The following are our roadmap for charting the course for a brighter and sustainable future in the health sector in our state and the nation. Arresting the brain drain. Central to the quest for the urgent reform of the health sector is the burning need to arrest the embarrassing rate at which our medical personnel are relocating to other parts of the world. This situation particularly has assumed a dangerous dimension in a manner that is leaving the health sector gasping for breath. This is because rather than beef up our yawning human capital need in the sector, we have created a situation whereby the sector is becoming so capable of retaining existing manpower. It is so bad that our doctor-nurse to patient ratio is now reputed to be one of the worst in the world. A recent report by the World Health Organization revealed that for every 10,000 persons in Nigeria, there are 4 doctors available to treat or attend to them. I repeat, for every 10,000 persons in Nigeria, there are just 4 doctors available to attend or treat them. In some other instances, we are beginning to witness an acute shortage of specialists in some critical areas of specialization. Turning the tide around will require that we find creative ways of incentivizing the sector by paying globally competitive wages to our doctors and enshrining a reward system that compensates hard work and is reflective of the aspiration needs of our medical personnel. We must create an enabling environment for our healthcare givers. Our starting point in OSUN is the full implementation of the revised Consolidated Medical Salary Scheme, COMES, and Consolidated Health Worker Salary Scheme, CONHES, for healthcare workers in the state. It is our intention to improve on this and set the state on the lane on global standards in the future towards an efficient, equitable, and affordable health insurance scheme. There's no doubt that the quest to achieving widespread coverage of health care for our teeming citizens will remain a mirage, except we'll radically extend the coverage of our health insurance policy to the poorest of the poor, who constitute our largest population. This program must be considered a basic privilege that all citizens enjoy, irrespective of their socio-economic status. It should take into consideration the economic dynamics of the country and ensure that access to qualitative, affordable, and accessible healthcare becomes a basic entitlement that all citizens of Nigerians enjoy. In OSUN, as I speak, we have begun enrolling 30,000 vulnerable youths across the state into our health insurance scheme. Provision of care facilities across all political wards in Nigeria, in tandem with the fact that over 50% of our citizens live in the hinterlands. It is important that Nigeria aggressively implements a deliberate coverage of basic and absolutely well-equipped primary health care centers to take care of the basic health needs of the people. Drawn from our modest effort in OSUN, we consider this a critical, non-negotiable, and apt response to combating sicknesses and diseases in infant and maternal mortality in the country and boosting our socio-economic status. This is because with the increased awareness that citizens do not have to travel too far away to obtain qualitative health care, they are likely to be increasingly disposed to seeking appropriate medical help. Standardization of indigenous medicine. More than ever before, our nation must now look inward and critically standardize marketing our indigenous medical endowment as both a means of creating alternative medicine solutions and a means of earning viable foreign exchange. With an aggressive tradomedical quest, our nation is better placed to tap into its old age varieties of medical plants available across the length and breadth of the nation. Our conventional and traditional health practitioners must work together to bring the best out of our health and medical architecture. Increased health sector funding. Knowing that building a prosperous nation will be impossible without addressing the obvious deficiencies obtainable in our health sector, it has become imperative that both federal and subnational governments need to recommit to funding the health sector in a manner that can ensure sustainable health sector development. There must also be conscious effort at funding research and providing requisite infrastructure and equipment needs for the sector, as well as creating training opportunities for medical personnel comparable to global standards, converting brain drain to brain gain. Given that the world has become a global village, it may, in truth, be difficult, at least in the short term, to stop the desire of some of our outstanding medical personnel to seek greener pastures, considering that nations all over are constantly seeking to strengthen their health system with high-flying medical personnel and will stop at nothing at enticing their commitment. What should then be our response? I propose that while working to create favorable working conditions for our healthcare workers, we also actively consider appropriating our enormous diaspora medical personnel capital by facilitating platforms, even if it is on a short-term basis, to engage Nigerian professionals serving in other parts of the world and get them to creatively commit to resourcing the nation's healthcare. This may be implemented through the conceptualization of national medical fellowships as a mark of honor for medical professionals who are deemed to have served or given back meritoriously. With technological innovation, they should not be difficult to implement. Raising a breed of committed medical patriots. I reason that another way, even if agreeable, to deal with the depleting human capital the problem in the sector is to ensure that we revamp our medical education curriculum in such a way that it instills civic consciousness and patriotism and encourages medical students to bond their services to the nation for a few years before considering the option of relocation where necessary. This is particularly so because the government, according to a recent Guardian report, spends an average of 50 million naira to train one resident doctor for 7 years, a figure which is far cry from how medical students pay in Nigeria. Okay? Pulling together our collective capital for development. The other option for us is to join hands with government to address some of the identifiable challenges in the sector. We all, particularly our elite, and corporate organizations must decide to join hands with government and take steps to solve our problems with definite practical interventions, knowing that no one will solve it for us if we fail to rise up to the challenge. In conclusion, the challenge of transforming the health sector is daunting and requires collective effort to surmount. We all must join hands to become true missionaries and agents of transformation of the sector. The experience of COVID-19 has taught us all that health is an emergency and a security/safety challenge. The maxim, health is wealth, has also made it clear that health is connected to all the sectors of the economy and all the aspects of human endeavor. It is therefore wisdom for us to consolidate on the gains of the past and strategize to chart a course for the future so that together we can deliver a strong, prosperous, and healthy life to our people, our state, and our nation. I thank you for listening, and God bless.
From the Executive Governor, State of OSUN, ably represented by the Honorable Commissioner for Health. Thank you so much for that. That was robust, succinct, and quite instructive. So, please, if you want to move this, platform, you can adjust it for your camera purpose. Okay, so we're gradually getting to the crux before we dovetail to the end of the event, but there's a video, a brand presentation video of OHIS that will be coming up right about now. Then we go to Unguvu Health, then we go to our roundtable discussion. So OHIS. Presentation. It's important to know that these people are a meditech organization that are doing so much to try and put the healthcare sector to a front-lining place. Please put your hands together for the founder and the CEO as it comes up.
Good afternoon, everybody. Good afternoon, Your Excellency, Governor Boyega Oyetola, ably represented by Dr. Rafiu Samotu, and I'm also representing, I'm also recognizing Dr. Ogini, the head of Osho State Health Insurance Scheme. All of the protocol duly observed. Before I go on, I have to commend the great work that's been done for the health insurance scheme. I was particularly happy to hear about the numbers, honestly, because we're working on, on something like this, unfortunately for another country. So when I got to hear that, and I was really impressed, I penned down the numbers. I was like, I need to speak with you after. So thank you so much for the work you're doing. So good afternoon, everybody. Doctors in the house. I'm going to do one thing before I go on. Please, can you all just stand? Please, can we stand? You're standing for yourself, don't worry. Yeah. All right. So now you stood up for yourself. Now I want you to give yourself a round of applause for making it to this point. Make it louder. You're not clapping for me. You're clapping for yourself. All right. Thank you so much for honoring that. You can have your seat. I mean, it's important for us to recognize ourselves. It's important for us to appreciate ourselves. And I will tell you why when I go on to present what we do at my company. My name is JFK. I was not called that. I'm not John F. Kennedy. I'm Joshua Fumbikoya. And I was born and bred in Osun State, Ile-Ife to be precise. Yes, so this is my state. I mean, state by birth. And I'm privileged to be the CEO of Nguvu Health. And before I go on to tell you what Nguvu Health is, you might want to ask, what does Nguvu mean? How many of us have that question in our minds? Yeah, so Nguvu means strength in Swahili. And in case you don't know, Swahili is the most spoken language in Africa with over 100 million speakers. And the reason is because we want people to be mentally strong. And that's why we started this company called Nguvu Health. I mean, my PA and my team member here will laugh at this because the reason why we started this company, it started because of the pandemic, you know, and a lot of people are going through it. A lot of people are going through issues, you understand? How many of us have been stressed before? Have you been stressed before? Not like you're just stressed. I'm stressed. From your Viva, from your medical class, yes? I've been stressed before, even from your patients that you're treating. Doctors in the house, yes? You've been stressed by, why is this patient troubling my life? What's your problem? You know, you've probably been stressed before. And I mean, that's to show that at one point in our life, we've all been mentally ill. That's the truth. Because if you have been stressed at any point, you've been mentally ill. And that's one of the things we're doing at our company. We're trying to change the narrative around mental illness and mental disorders. We have a variation of them. Your doctors, you've been told what depression is, anxiety, bipolar disorder, schizophrenia, ADHD. I mean, you can name it all. We have a variety of mental health disorders. And one of the problems that we found out is that a lot of people don't even know where to go for this help. They go to the wrong people. Some go to talk to their parents, some talk to their teachers, to their lecturers, to their pastors, to their imams, to their herbalists. But then these are not the professionals that you are meant to be speaking with. And that's why we founded Nguvu Health, to make it accessible for you to reach the right people that would help you through your stressed moments, or your depressed moments, or your anxious moments, and so on. Also, we found out that it was really like expensive for you to speak to a therapist. These are psychologists, clinical psychologists, or psychotherapists, or even on the more medical line, psychiatrists, right? And we've made it affordable for you all, for Africans, for Nigerians, for Africans to be able to seek this help. And that's why we created Nguvu Health. So please, I know we are all using smartphones, so can you just like go to your Play Store or App Store? You can first download the app, so please, you need Wi-Fi. I wish that I put this thing on, no, Jesus Christ. You know, don't worry. But when you can take a mental note of this, for those who have internet, you can just get to do it. Don't worry. Elon Musk, I sent him a message like last night. He's bringing Starlink. He's bringing Starlink to Africa, so you're going to have free internet very soon. Jokes apart, though. I didn't speak to him originally. Don't go and quote me online. No. I'm just joking, please. But right, just take a mental note and download the app. Right, it makes it easy for you to actually speak to the therapist. We have a lot of interesting things for you to do on the app that are even free. So, how many of us go to Twitter or Facebook or Instagram to go and rant? Something's going on with you. You go and talk that I don't even know what's wrong with this lecturer of mine. How many of us? How many of us know violence? If you are on Twitter or something, they'll say, "Oh, you are choosing violence." Hello, I'm not talking to baby boomers. I'm talking to Gen Zs and millennials. So why you people respond, please? How many of us know what violence means on social media? You get it. So on our app, we have what we call the Rant Room, because a lot of people go online to go and actually rant and talk about what's going on, but only for you to get backlash and even get worse than what you felt like earlier. So our Rant Room creates an opportunity for you to rant anonymously. People don't need to know that you are the one talking. You can go and talk. You can open it up for people to respond to you, because there is a link between mental health and physical health. Our doctors will, can confirm that. I'm sorry, I'm not a doctor, but yes, but I know that mental health is connected to physical health. Mental health is health, right? I'll give you a real life example. In Abuja, there was somebody that had a high blood pressure and went to a doctor, and then they were like, what's wrong with you? Your vitals are okay. And then the person started talking, and when it was done, they checked the BP, and then it was over. Like, they saw that the thing had dropped. So we have that feature. On our app, you can chat with the therapist. You can schedule like a video therapy session with the therapist affordably, right? This gives you an opportunity to actually like take care of yourself. So that's why I also told you all to stand up and give yourself a round of applause, because oftentimes we don't give ourselves much credit for the things that we do. Briefly, for 1 minute, I'm going to have my team member Adeolu come give a talk. I'm calling Adeolu because he's a final year medical student of Obafemi Awolowo University. And if I'm talking to you, you may not understand that what does this man know, but he can shed more light and tell you why you actually need this, and from a doctor's perspective, Abi. So Dr. Adeolu, thank you very much.
Thank you very much. It's a big privilege to be here. It's so amazing to be here, to be with my colleagues. Big ups to the team, big ups to Tim Tayo and his team. He said he was going to do 1,000, and I'm like, okay, I trust you, and he did it. So please, can we applaud the team, please? So my boss was talking about Rant Room, talking about therapy, but first and foremost, I think the most important thing for us to do is that everybody here at one time had experienced anxiety, had experienced stress, PTSD, that's post-traumatic stress disorder. And we all know that we don't have the license, or how will I say it, even because we are medical practitioners, I'm not going to assume that everybody here is a doctor. I think there are medical lab scientists, nursing students, pharmacists, med rehab, physiology, anatomists. See, everybody is important in the health sector. So I'm not going to assume that we're just all doctors here. And we all know that we have our fair share experience of these things of life, majorly. So what we did is that we created a free screening session whereby you can go to the app right now, take a free screening session whereby you can take a free screening, anybody, you can take a free screening session on anxiety, PTSD, substance use, suicide, depression, ADHD, that's attention deficit hyperactive disorder. There's also what they call it, mood disorders. So for mood disorders, we know that we have them bipolar and the likes under mood disorders. It's a big family. So you can just check it now. Just go to your Apple Store, Play Store, and download, right? And the reason why we thought about this is because we understand that a whole lot of things are happening in people's life that people are not even comfortable to share at one point or the other. And this is not about students, even adults, parents majorly. We know that this month is Mental Health Awareness Month. And who knows the theme for this month? Who knows the theme for the Mental Health Awareness Month? Nobody? If you get it, I'll give you something. We came bearing gifts. If you get it, I'll give you something. Okay, son, are you raising up your hand? Are you raising up your hand? Yeah, just echo it out. I can't hear you. No, that's not the team. The team for the Mental Health Awareness Month. Go in. No, I can't give you. You know it now. Any other person? Okay, the team for this. Okay, what's it? No. No. It is loneliness. Loneliness is the theme for this month, for the Mental Health Awareness Month. May is Mental Health Awareness Month. And according to research and data, adults tend to suffer more from loneliness, chronic loneliness, especially in this situation and this era whereby a lot of people are leaving the country and they are leaving their parents behind. So there's more or less like we saw this and say, okay, one of the things that is in the pipeline for us as a company is to create a support group whereby the way you are around table right now, you can actually do a round table online and have conversations with yourself to support each other. So that's one of the reasons why we did this in Google Health app, in Google Health, and you can download from Play Store, Apple Store. So I'm just going to bounce now. It's nice talking to you guys. Have a lovely event. Thank you.
Yes, thank you so much, Dr. Adeolu. Like you mentioned earlier, we're comparing gifts, and there's something that I don't know if you're all aware, but we had like a partnership with Nigerian Medical Students Association where we give Nigerian students 10% discount for the therapy sessions that are held on the app. However, we have another session later. Who knows, we may be giving actually free therapy sessions for those who are in need of it, like today. Courtesy JFK. Thank you so much for your time. Thank you, Temitayo, for inviting me. And yeah, let's give them a round of applause, please. Thank you very much.
Thank you so much. I can assure you that you have something to eat, so don't worry. We can't put you guys together without giving you something to eat. If there's no food today, don't hold me. It's that guy you should, Tayo. But let me just quickly give a breakdown of the things that we have to do next before we end so that you can have a flow. So we'll be having a short session from the OSUN Insurance Health Scheme. Then we'll get a quick goodwill message from somebody. Then we'll go to the round table discussion. And trust me, there are giveaways also. So relax and calm down. So right about now, let me just quickly bring Dr. Ogine to talk about, the health insurance scheme. Briefly, very briefly, sir. The video, unfortunately, the sound is not coming up, unfortunately. And the honest truth is that the OSUN Health Insurance Scheme partnered and sponsored hugely to ensure that this event came to play. So please, as a result of the honest help from someone like him, we have this today.
Well, thank you very much. My commitment to NIMSA did not just start now. I was the Secretary General of NIMSA in 1987-88. And I was involved in all of these medical student activities. And that's why I actually congratulate Temitayo for bringing this number of students together to come and learn concerning public health and the future of public health in this country. The OSUN Health Insurance Agency was established by law in the year 2018, October. It was assented to by Mr. Governor on the 20th of November 2018. We started our activities early 2019. By 2019, October, we started giving service to accredited facilities accredited facilities were giving service to enrollees. We started with 0, but today the figures are very clear. We already have over 210,000 active enrollees that are receiving service under the scheme. Now, what makes OSUN Health Insurance Agency second to none? And when I say this, I say with a very high sense of responsibility that we are second to none in this country, because at the moment there are beneficiaries of this scheme that are assisted to the tune of 4 million, 4.5 million for their conditions. There is no other health insurance scheme in this country that does that. It's a social health insurance scheme, but it is there. Our fund is growing, and our fund is not being mismanaged. Our fund is managed properly with transparency and accountability, and every enrollee of the scheme has the access to the funds depending on the veracity of their conditions. We will only need to confirm what you are suffering from, and then the hospital will give us the details of what they need. And aside from the benefit package, aside from those conditions covered in the benefit package, we're going ahead to do financial assistance in order to meet the mandate. Our mandate is to ensure that there is a gross reduction in out-of-pocket expenditure for health, so that every family will not be afraid. If you have a person that develops cancer in your family, we just had a patient with cancer, a civil servant. We did all the surgeries that they needed to be done, and of course, I needed to be done. And we are even paying for the chemotherapy. Now, no other health insurance, social health insurance agency does that in this country. Now we have also taken on very complex orthopedic conditions from patients that had road traffic accidents with multiple, injuries. We took over the management and we paid over 2.5 million for somebody who is just contributing how much in social health insurance. That is the beauty of health insurance. Aside from that, our vulnerable population, aside from the 30,000 which we have just commenced enrolling, we already have over 79,000 vulnerable persons that are receiving treatment under the scheme. The scheme started a bit later than others in the country, but the scheme as of today has taken the second position in terms of all the developmental parameters, establishment of agency, board, then number of enrollees, number of facilities that you have accredited, all of those we have actually, and then of course I'm so happy also to inform you that there is no other health insurance agency in this country that has captured all the patients suffering from tuberculosis. Those that are in the tuberculosis and leprosy program of the state, all of them are fully enrolled under the state social health insurance schemes. And in fact, we presented this at the National Conference on Tuberculosis and Leprosy, and we're given an award for this. So we are going on and we are getting stronger and stronger as a social health insurance agency. Like in the governor's speech, he said we're second to none in the entire Southwest. Lagos State has just started social health insurance scheme. They're far behind us in the area of implementation of social health insurance. And they, of course, have different private health insurance, but private health insurance and social health insurance are two different things. They are very different because social health insurance operates on the principles of solidarity, social solidarity, that a man takes care of his fellow man. The people who do not have means are taken care of by people that have means. The people who are strong are take care of those who are weak. And those who are poor are taken care of by those who are rich. That is the principle of solidarity in social health insurance. It's quite different from private health insurance, where I go to these people who are HMOs, I tell them, I want you to give me, a policy, and they say, look at you. If you are fat and you have a round tummy, they say this man is a big risk, and they will give you a very high premium for you to pay. It is not like that as far as social health insurance is concerned. Social health insurance introduces equity to access to care. So that is so far what we're doing. And we have created a lot of jobs, both direct and indirect jobs for the teeming youths of the state. We have over 890 people that have been employed since we came on board, indirectly by HMOs, by healthcare providers. We're also improving the infrastructure. I see you're talking about the status of public health facilities in the country. We are improving infrastructure in public health facilities. Recently, we facilitated the procurement of chairs, fanciful chairs, tables, medical and laboratory equipments in our hospitals. And we are also deploying in all of the accredited hospitals now. We have installed solar so that the health management information systems can be done seamlessly. We have also distributed computers to all the 16 accredited government hospitals, and now they have printers, they have UPS, they have solar. So at any point in time, they can capture their data and transmit the data without any hassle. That is what we are doing at the moment in Osun State. So we can see that capacity is being brought to the public health facilities. Now, in recognition of the fact that if you put all the state-of-the-art infrastructure in a place, if you don't have manpower, the infrastructures will remain white elephants. Now, what we have done also is to go into collaboration with retired doctors, retired nurses on ad hoc basis. Pending the time that government will be able to employ people on a full-time basis, we're now engaging retired doctors and nurses who have experience and who are still strong to work. We're engaging them to take care of some of those government hospitals where they can build confidence in the enrollees. Like the governor said in his speech, confidence is being restored. The people's confidence is being restored gradually in our health facilities because of all these interventions that we're bringing in. And I'm sure in a few months' time, you'll begin to hear that we are building our permanent structure. The OSUN Health Insurance Headquarters Complex is soon going to take off, and it's already in the budget for this year. Mr. Governor has approved of it, and very soon, before the end of the year, I'm sure that our building, the permanent structure, will be, if not completed, will be near completed. So what I want to say is that let everybody, those of you who are students in state health, tertiary institutions, you must have heard about the TSHI program, the Tertiary Institution Social Health Insurance Program. All of you can access care with your identity card as students of tertiary institutions in this state. And even if you have any condition anywhere in Nigeria, where, God forbid, but if you get involved in an accident or you have an emergency situation, so long as you are carrying your card as a bona fide student of a tertiary institution in this state, all you need to do is just call the HMO that is in charge of your school. Once you get the HMO through the health insurance agency, they will treat you wherever you are in this country, and the bill will come to us and we will pay. This is part of the things that we have been doing, and this is actually giving us a competitive edge over other people. Those of you who are representative of medical HMOs know how much we are regulating. Just last week, Fountain University, Redeemers University, Ademola University, Bowen University were getting involved in ensuring that they bring on board their TSHI program, that is the Tertiary Institution Social Health Insurance Program, so that we can work to ensure that nobody is left uncovered. Whether you are a student, or you are a worker, or you are an artisan, or you are a babaloger, a yaloger, NURTW, transporter, whatever, we have programs for each of these segments of the population. So I thank you very much, and I want you to carry the message of OSUN Health Insurance wherever you go to. In case you want to know more about OSUN Health Insurance, you can Google www.oshia.ng. If you have it, you can go there, www.oshia.ng, and you'll get to know everything you want to know about us. Thank you very much. I wish you a very nice meeting.
Thank you so much, sir. That was succinct. Quick one, there are some other persons that have been instructed to recognize and bring to the seats that are here. The very first person is representing the Provost, Osun State University. No other person than Dr. Mrs. Professor C.O. Alebiosu is the Provost, but the person that representing him is Dr. Mrs. Omobua. Please come up. Wow, evidently loved by the students. Interesting.
Hello.
See, the executive governor is taking his exits. Thank you so much for coming around. Also, I've been instructed to bring up to this table also the state coordinator, AC Health Initiative, Mr. Ayobami Alabi. Where are you, sir? Please come up. Please come up. And right about now, we'll be hearing a goodwill message from someone who is very young and vibrant. He is a governorship candidate of the Young Progressive Party. Please put your hands together for Dr. Ademola Debussy as it quickly comes up shortly for his goodwill message. Then we'll get to the main crux of the event. You're welcome, sir.
Thank you so much. Hello, everybody. All right, so it's an amazing experience so far. I'm happy to be here. This actually reminds me of myself just a couple of decades ago. I hope we are not like surfing. Well, they said there's no Wi-Fi, so we're probably all here, probably trying to read some documents or trying to do some school stuff. So my name is Bayonle, like everybody said, like you rightly introduced. I schooled at University of Ibadan. Moved, yeah, let's give myself a round of applause, please. Yes. I moved to the US, studied public health in Boston University. Thank you. And I have been in public health for the past couple of years. Well, I've come back as a part-time politician, now running for office of the governor. You can see me shaking the Commissioner of Health very strongly. I'm trying to unseat his boss. Don't tell him. Well, medical students or allied workers, I think the information I bring essentially is that I understand the optics. I understand what we are seeing at this point. Like I said, it wasn't long ago I sat probably where some of you are sitting right now, been listening to a whole lot of information, and we're like, what am I supposed to do with all this? I do not understand. How does this affect me? I have an exam to write. Please let me out of here. When are they going to serve Coke or whatever? What I want to tell us is that please, there's a bright light at the end of the tunnel. You see, a lot of us don't see the optics, like I said. We are not privy to what we're seeing just because of the occurrences around us. We are not inspired by a whole lot of things we see. We wake up every morning, see the same boring faces, get a lot of abuse on the wards, and of course, suffer through whatever we want to suffer. But I can promise you, there's a whole life ahead of us. And if we persist, I mean, go through this space and this area, I'm sure in a couple of years, we'll be at that tunnel. Again, I've brought you, I'm a victim of brain drain. For once, I'll tell you, if you have to travel, please travel. Well, I don't want that to be recorded. Please do. Healthcare has evolved. It has evolved so true exponentially. I mean, there were times we used to do exploratory laboratory. I don't know if we still do all that. People should be sued for doing all that right now. Later, we moved to minimal invasive techniques. Sometimes where we practice right now. Meanwhile, I practice at Brigham and Women Hospital, Boston, Massachusetts. It's a teaching hospital for Harvard Medical School. So we have a lot of amazing cases. We have now moved into video-assisted surgeries, where we can see internal organs from right from the patient's bed. And right now we're doing a study on robotic surgery. And what that can assist you to do is that we can actually have a patient here in Osogbo and the surgeon is in US or UK and remotely perform a surgery on that patient. Those are the advancements in surgery and in medicine that unfortunately we don't see. So we get so tired easily. Going through the medical practice is essentially stressful. I can't imagine waking up, not having good food. We don't even have Wi-Fi and all the ramifications. But like I said, there's so much bright light at the end of the tunnel. And if you want to, like I've said, I was going to tell the commissioner that it's not only improving wages that helps us to stay, someone like me. You see, you want to enjoy your practice. I wake up every day. I want to go to the hospital because I want to see the brilliant faces of people I work with. We have a lunch, actually, every day at my job. We probe the boundaries of medicine. It's an open forum. I have emeritus professors. I have Nobel laureates, actually, where I practice because it's a very huge center. And it's a level playing ground. Nobody's old, nobody's young. You bring your idea to the forefront. You enjoy your practice. In fact, whatever we do at my center involved is what all other centers around the world actually does. So it's a very interesting space. And of course, when I leave, I go to my house, no issues. I don't think about security. I don't think about all the other issues. And those are the things that we're looking for, young people like us. Am I lying? We want to enjoy our practice. And when we also leave the comfort of the university or the hospital, we also want to live a good life outside. So if you are inside, and of course it's good, if you're outside and it's not good, you want to leave. It's not always about the money. Even if you're earning peanuts, you want to enjoy your practice. So once again, it's an amazing experience to be here. I thank you so much for inviting me. I look forward to seeing all of you at some point. One of the things they don't tell us, well, lastly, is that when we finish all these amazing programs, you see, Dr. Ogini, what he does essentially is powered by politics. They don't tell us to participate in politics. He's an amazing man. He's doing so much for all of us. But you see, he probably has to be nominated by a politician. His works are being checked by politicians. So for us to actually enjoy whatever we're doing, please, at the barest minimum, let's be engaged. Let's know what is going on in political spaces. We can be professors, consultants, or whatever, but you see, we are still vulnerable to the type of leadership we have. And that's why someone like me have left my space. I think that the future is bright enough. I think that we medical practitioners deserve a better experience in our healthcare delivery, and I'm happy to provide that for you. God bless you. Thank you so much.
Thank you so much, Dr. Bayonle. Straight up, we'll be moving to the round table conversation. I'm sure our speakers are set, but then my colleagues here told me that let's do some airtime giveaways, you know. But they are sure they're going to love it. Let's start from Glow. There are a lot of Glow airtimes here. I don't know why. Unfortunately, Airtel users, maybe not today. Etisalat users, maybe not today. Unfortunately, but M10 and Glow. So quickly, are you set? A lot of Glow. Are you with your phones? Let's start with Glow. All right, so quick one. 417767310538 Who won it? I beg me in our talk. We've got a winner there. That was 1,500 naira airtime. There's still another one. There's still another one. Don't worry. I told you we have enough for you people. You know, I was speaking with somebody, you know, behind the scene here. I was like, why are people, you know, like that? I said, don't worry. I know how to ginger them. Get me airtime. And you see they are gingered. Next one, Glow. That guy will win him. Drop your phone like that. Let another person win it. 417767378212 Eh? I don't understand. Please, what's happening? Card is being used. Sorry, who won it? Another 1,500 naira. MTN, quickly. MTN. Don't worry, we have enough. We have enough. Oh yeah. Sakpan a bad thing. Wallahi. MTN. 44. Funny thing is that my wait. It might be that it might be the security man outside that will win this thing. Can we do it that the speaker will not reach outside? MTN 448187311502 Who won it? Another 1,500. Ukpo, yeah. All right, another MTN. Oh. Another MTN. Are you ready? Or I should carry my airtime. If you are ready, say that, yeah. That Alaja is not talking. I'm taking my airtime. Alaja, say that, yeah. Check my Jazzy. MTN, let's go. 0299560545256452. Who won it? Hey, 15 airtime. Much more to come in a jiffy, and I can assure you we still have some interesting things lined up. We're going straight to the round table discussion. Where's Temitayo? Okay. DJ DJ, give me something light. Give me something light.
My baby, my Valentine. Can I hear the making my temperature the rise? If you leave me, I could die. I swear, you are like the oxygen I need to survive. I'll be honest. Your loving me totally me. I am so obsessed. I want to chop your body. I want to never come to see you. Upon a make I
We're going to be taking a citation of some of the speakers on the roundtable conversation. And Dumami, do we have the people that are going to do that? Okay. All right. So please put your hands together for this adorable, beautiful girl. Let's go up so that they can see you. She's actually down to heart, so I want to take her higher so that you'll be able to see her very well. Please put your hands together for her now.
Good afternoon, everybody. My name is Dumomi Dwejaye, and I'll be taking the citation for the roundtable panelists. Ademola Debussy. Ademola Debussy is a gender-based activist, development worker with particular focus on children and women, a mission-focused manager with exceptional and well-rounded strategic planning and project management skills, results-oriented and dynamic individual. Is a development knowledge facilitator, a development activist, a leader and a team player, a gender-based violence activist. Ademola Debussy is the founder and executive director of the organization Value Reorientation for Community Enhancement, Value Reorientation for Community Advancement, VAS, is a non-governmental and non-profit making organization. The organization is working on children, women, youth, health, and development issues. Please let's give a round of applause for Ademola Debussy. The second roundtable panelist, Joshua Koya. Joshua Koya is the CEO of Nguvu Health Inc., an on-demand teletherapy platform for Africans both at home and in the diaspora. He is passionate about innovative tech solutions, mental health advocacy, as well as blockchain and supply chain domains. Mr. Koya has rich and broad industry experience in entrepreneurship and management, having served in various roles as the membership and digital engagement officer at the Nigerian British Chamber of Commerce, general manager at City Info Africa, amongst others. He has shown great expertise in his field, yielding outstanding growth and having a knack for building better. Mr. Koya holds a bachelor's degree in electronic and electrical engineering from the prestigious Obafemi Awolowo University, Ile-Ife. He has led Nguvu Health to be recognized as the 6th Google for Startups Accelerator Africa, as one of the organizations to have developed unique solutions to the mental health challenges in the continent and beyond. A serial volunteer, he has volunteered with the United Nations Population Trust Fund, CUSO, a Canadian non-profit development organization, and was the president of the Community Development Service during his service with the National Youth Service Corps. He believes in the power of youth to unlock the potentials of the African continent, one for positive vibes. In his leisure, he loves to have fun, conversations, visit nice places, read, and plan dates. Please let's give a round of applause to Mr. Joshua Koya. Ms. Rhoda Robinson. Rhoda Robinson is the executive director of AC Health Initiative, a development organization focused on empowering and supporting underserved populations, especially women and young people. She is an accomplished development practitioner with over 13 years experience and successful track record in developing and implementing high-impact interventions towards addressing development challenges and achieving the goal of a healthy and sustainable society for all. She is an advocate for the rights of women and girls, and a strong supporter for gender equality and equal participation of women and men in decision making. Rhoda received a Bachelor of Science degree in Physiology from the University of Ilorin and holds a Master's degree in Gender Development from the Institute of Development Studies, University of Sussex, UK. She is a Fellow of the Abshire Inamori Leadership Academy, AILA, at Center for Strategic and International Studies, Washington, D.C. Rhoda is an alumni of the Cody International Institute Global Change Leaders Program at St. Francis Xavier University, Canada, and an executive member of the United States International Visitors Leadership Program Alumni Association in Nigeria, and an alumni of the Women in Successful Careers, WISCAR. Rhoda is a mentor for young girls and young women aspiring to make a difference in their societies. And then to the last roundtable panelist, Dr. Adeniyi Samuel Ogini, MBCHB, MPH, Community Medicine, PhD Ecology and Environmental Science, SATS MM4H, Edinburgh. Dr. Adeniyi Samuel Ogini graduated from Obafemi Awolowo University, Ile-Ife, as a medical doctor in 1989. He bagged a Master's of Public Health, Community Medicine degree at the University of Ibadan through a World Health Organization Fellowship Program in 2006 and obtained his PhD in Ecology and Environmental Science from Obafemi Awolowo University, Ile-Ife, in 2017. He is the Executive Secretary of OSUN Health Insurance Agency and the Chairman of the Forum of the CEOs of State Social Health Insurance Agencies in Nigeria. His research interest is workplace safety and healthcare financing. His doctoral thesis assessed the health of metal smelters in a fast-growing factory, and he is currently in a collaborative research assessing compliance of hospitality facilities in Kampala with the 100% smoke-free law of the government of Uganda. Please, let's give a round of applause for our roundtable panelists. Thank you.
Hello. Sade.
So quickly the.
Listen. Why do you pariwo? So nǹkan tó bá sọ mo sọ pé wọ́n bá mi pariwo mọ́ kí ló need. Ó fẹ́ ṣe irun. Ó lọ pàtì. Tó lálẹ́ máa pariwo 12,000. Èló ní 12K. Ó sọ fún pé mi ò ń ṣe àwọn you want to be boyfriend get anything. What's the need to buy? What's the need anything?
Kíni. Ọ̀gá onígbòlógbò. Ẹ̀jẹ̀ dìyúdì. Kí ló dé yún? Ẹ má jẹ́ kó jábọ̀ ẹ̀jẹ̀ wọn ní girlfriend. Ẹ ṣọ̀pẹ̀ màmá lábọ̀. Ẹ wọ ẹ ti kó golo. Kó dágbolo ẹ ti kó golo.
Ẹ jẹ́ kó ọgbọ́n wọn ní tẹ́lẹ̀. Wọ́n rí pé méjì yìí ò tó ẹyọ kan.
Kí ló fẹ́ fi yé?
Kò tó kà á. Kúrú ìjọ ta ló pè sọ̀rọ̀. Ta ló ní golo? Ìwọ ni wàá ní golo. Ìwọ náà wàá ní golo.
Wẹ́ẹ́ ti ní golo.
Ṣadé jọ ẹ̀yìn pé ẹ bá ṣèlétà mo bá wọn síngù kan sọ̀rọ̀.
Àǹtí Ṣadé àbọ̀rí ti kó golo. Ẹ tó tiẹ̀.
Tí mo pẹ́ sọ̀rọ̀ mi, tí wọ́n tẹ̀ ní golo, I have it for myself.
Àǹtí Ṣadé ń kọ́. Àǹtí Ṣadé ń kọ́.
Hotel family àti Ṣadé ń kọ́.
Ìdílé yín yóò lè pè yín. Ẹ̀jẹ̀ yín.
Kí ló ṣẹlẹ̀? Má mọ̀ ẹ́ ní à.
Ẹ lọ forúkọ sílẹ̀ nílé iṣẹ́ wọn tó wà ní Ògo-Olúwa area lẹ́yìn ilé Ọ̀sándò ilé ẹgbẹ́ àwọn dókítà lọ́ṣogbo. Ẹ sì tún lè forúkọ sílẹ̀ lọ́dọ̀ àwọn aṣojú wọn tó wà káàkiri ìpínlẹ̀ Ọ̀ṣun. Fún àlàyé tó kún kẹ́kẹ́ ẹ lọ sí www.oisia.ng. Àjọ OIS lóní má dágun lásọ̀rọ̀ ìlera rẹ lọ fún.
Ẹ lọ forúkọ sílẹ̀ o. Ẹ má kó golo. All right, there are two other persons that will be joining the speakers for the roundtable session, and to make 6, she read 4. The first of them is Mr. Debussy Abdullahi, that is representing Mediplan HMO. And the 6th is Dr. Subar Kolawole, the Executive Secretary, Osun State Primary Healthcare Development Board. So we're going to be dividing this all right about now. And please, our speakers, help us, maximize and round off your thoughts in the space of 10 minutes, if that will be permissive. So the table, Taya, please come. This side, right? So this side is for mental health and teletherapy. Okay, let's just call this side A. Are we together? Side A. And this side B. Are we together? So this place, this is B, A ends here. This side up to here. We'll call it C. Oh no, let's up to this place. This side is C. Do we get that? This side D and this entire side E. Do we understand? This side E, D, C, A, and B. Do you understand? So I can assure you it's going to be as interactive as possible, and just try and engage your speakers. Okay. So like I said, all of this will not be E. This side will be E and this side F. Do we get? This side is E and this side is F. It's F. No, it's not the F for fail now. Yeah, they look say no be me, go be F. Don't worry. So we'll be assigning speakers to you right about now.
Good afternoon, everybody. I'm very sure that some of us are probably wondering, what are these guys up to? I just want to eat and get something to eat. Yes, refreshment is covered. And this is the last session, the last speaking session. But we are trying to make this as interactive as possible. We know that all along we've been listening to speeches and discussions. I mean, we've not even had we've not had the opportunity to ask questions. So that's why we're having this session now. In this session, there won't be a microphone. The microphone will be right here, but we'll be having our speakers join us, and right at the middle of our groups, they will be leading conversations. Now, we would remember and we would bear witness to the fact that a major aspect of this event is to evaluate existing policies, existing laws, try to pinpoint the gaps in these laws, and try to provide our solutions. That's why we have invited the finest of allied and health personnel to speak to us today. So the roundtable discussions we are having now, from the word, it's a discussion. So our speakers, our panelists are going to come down to us. Each group will get a panelist, and then after some time, we will rotate, we will swap. So during the course of the discussion, we will be engaging the speakers for 10 minutes each. 10 minutes each, we'll be engaging the speakers on the existing laws, on the particular aspects that they are discussing on, and then we also try to provide solutions to try to evaluate the gaps, the policy gaps in those laws, and from there provide solutions. So group one, can you raise up your hands, please? Group one. All right, thank you very much. So group one will be having Dr. Adeni Yogini now for the first session. A round of applause for him as he finds his way. Please, can the protocol member in charge of group one help Dr. Adeni Yogini find his way? Group two will be listening to Mr. Ademola Debussy now. Dr. Adeni Yogini will be leading discussions on health insurance. Mr. Ademola Debussy will be leading discussions on SRHR, sexual and reproductive health. Please, the protocol member should kindly help Dr. Adeni Yogini and Mr. Ademola Debussy find their way. Group two, please. This is group two, sir. All right, thank you very much, sir. Group three will be listening to Mr. Joshua Fumbikoya, who will be leading discussions on mental health. Mental health, group three, sir. Yes, sir. Group 3, please, can you raise your hand so that Mr. Joshua Koya can recognize you? Group 3, a round of applause, please, so that I can recognize you. Thank you very much. Thank you very much. Group 4, a round of, can you raise your hands, please? All right, thank you. Group 4 will be listening to the representative from the Primary Healthcare Board, in person of who is representing Dr. Subeir Kolawole, who is the Executive Secretary of the State Primary Healthcare Board. So Group 4, can you please wave your hand so that our guest speaker can recognize you? Thank you very much. Please join them, ma. Thank you very much, ma. Group 5, can you please wave your hands? Thank you very much. For Group 5, we'll be listening to our representative from Hazy Health Initiative, who is the state coordinator. Group 5, please wave your hand so that he can recognize you. Thank you very much. Group 5. Okay, and then Group 6 will be listening to our representative from Hazy Health will be leading discussions on FGM, female genital mutilation. That's Group 5. Then Group 6 will be listening to our representative from Mediplan HMO. So Group 6, please wave your hand so that our representative can recognize you. Thank you very much. That's Group 6. And the discussions will run for 10 minutes. I can see Dr. Ogini has started already. So very quickly in 10 minutes, and then we will swap all over again. And in the course of these discussions, we will be distributing questionnaires at random, just at random. Just take it, fill it very quickly, and then we are done. We want to have a feedback, have an evaluation of what we think of these laws. So thank you very much. We'll be dropping the microphone now in 10 minutes. Thank you. And sorry, please, the way the seats are arranged, you can move your seats so you can hear what our speakers are saying. Your tables are safe, don't worry, but please move your seats so that you can hear what our speakers are saying. This is the exact reason we got this kind of hall, so that we can move our seats, and we didn't get the typical lecture theater kind of hall. Thank you very much. Please move your seats so our speakers can hear what you're saying, you can hear what our speakers are saying. Thank you very much. All right, thank you very much. A very big round of applause for our speakers. A very big round of applause. I felt that was very interactive. So very quickly, Dr. Ogini will be moving to group 6 now. Dr. Ogini will be moving to group 6. Group 6, can you clap your hands, please? Oh, sorry, I missed the group 5. Group 5. Group 5, can you clap your hands? Dr. Ogini will be joining you. Group 5, at the very my left extreme. Please help him find the way there. Mr. Debussy will be moving to group 4. Group 4. Group 4, please wave your hands so Mr. Debussy can recognize you. Group 4. All right, thank you very much. A round of applause for him as he finds his way. Mr. Joshua Koya is still dishing knowledge, but please, sir, kindly move to group 1. Group 1, thank you very much, sir. Thank you very much. Our representative from the Primary Healthcare Board, ma'am, kindly move to group 2, ma'am. A round of applause as she finds her way. Thank you very much, ma'am. Thank you very much, ma'am. Mr. Joshua Koya, moving to group 1. Representative of the ES from the Primary Healthcare Board will move to group 2, and rep from Mediplanet HMO would move to group group 4, I guess. Group 4, can you clap your hands, please, so that we can recognize you? Oh, okay, there's somebody there. Group 3, sir. Rep from Mediplanet HMO, please. Group 3 to my left. Yes, sir. Thank you very much. Oh, okay, sir. The last group then, sir. The last group, that's group 5. Thank you very much. We'll go for another 10 minutes. Thank you. A round of applause for our speakers as they join us, please. round of applause for all our speakers. Thank you very much. A round of applause. So very quickly now, Group 3 will be receiving Dr. Adeni Yogini. Group 3, a round of applause so Dr. Yogini can recognize you. Group 3, a round of applause. A round of applause for Dr. Ogini as he finds his way to Group 3. Group 2. Group 2 will be receiving a rep from Hazy Health Initiative. Group 2, a round of applause to so our rep from Hazy Health Initiative can recognize you to discuss FGM. Group 3, please. Oh, Dr. Ogini was meant to come to Group 3, exactly. Okay, thank you, sir. So Group 2, please, a round of applause so our rep from Hazy Health can recognize you. So we have Group 2, Group 3, Group 4, please. A round of applause so Mr. Joshua Koya can join you. Group 4, Mr. Joshua Koya. A round of applause. A round of applause so he can recognize you to my right, sir. Group 4. Thank you very much, sir. Group 5 will be listening to Mr. Debussy from Vast Nigeria. Group 5, Mr. Debussy from Vast Nigeria. A round of applause. And Group 6 will listen to our rep from, Group 5 will be listening to our rep from Mediplan HMO. Sorry, there's a little bit of confusion. And then Group 6 will listen to Mr. Debussy from Vast Nigeria. Looks like we mixed up the numbers. I wasn't writing. Okay, I think Hesi is Group 1, yeah? Did I say that? Okay, please, groups without a speaker at the moment, please, can you wave your hands? Groups without a speaker. Then it's most like, okay, yeah, you can handle 2, sir. Okay, then Group 1, groups without a speaker at the moment, please, can you wave your hands? All right. Okay, we've not listened to our rep from the Primary Healthcare Board. Our sincere apologies, ma'am. Please, ma'am, kindly join Group 1, ma'am. Kindly join Group 1, ma'am. Thank you very much. We'll go for another 10 minutes. Thank you. Thank you very much. A very big thank you to our speakers. Please kindly give them a round of applause. Very quickly, before we make the last swap, while we were having our discussion, we received the Honorable Special Advisor to the Governor on Public Health, who was nearby and thought it wise to join us in this event. And we would love to receive a very short remark from him before he takes his leave. We have welcome with me with a round of applause, Honorable Shiji Olamiju, the Honorable Special Advisor to the Executive Governor for Osun State on Public Health. You are welcome to the podium, sir. We'll go very quickly before we have the last swap.
Good afternoon to everyone. Great Nigeria students, articulate Nigeria students, ever-conscious Nigeria students, great Gogo, great Gaga, great Shiwa, Mashiwa. I greet everyone and I welcome everyone to this very important epoch-making and maiden edition of Health Summit organized by you. This is the first of its kind in the state of Osun. And I must tell you that the state government under the leadership of Mr. Gboyega Oyetola, the executive governor state of Osun, is happy having this kind of program. Why? Because it is in tandem with our own program. The flagship of this administration under its leadership is healthcare for all. And lo and behold, we are having Health Summit organized by you. A round of applause for yourselves. Mr. Governor has been represented there by my dear colleague, Honorable Commissioner for Health. And I believe all of us here listen to his speech. Our governor is a talk and do governor. And I can assure you everything that has been said there will be done. Yes, I want to appreciate every member of the panel. I mean all the panelists, all the professionals that have spoken, that has imparted each group one after the other. I could see the head of my health insurance scheme in the state, my brother Dr. Niyi Ogini, the Dr. Mrs. from Primary Health Care Board, people from SCH, and my dear brother interpreted the FAP laws and others. But one thing, we're having this kind of program for the first time. The essence of this is very huge. One, we are having almost every profession in the healthcare sector represented here. And that is the beginning of the collaboration. We are talking about the collaboration we are preaching to have in the healthcare sector. I thank you very much. And I can assure you, as the Lord lives, the next one you are organizing will be highly supported by the state government of Osun. I can assure you that. Since I've been here, I've taken a lot of videos directly sent to him, and he has even tuned to that your Zoom site. Despite the fact that he's busy today, we are receiving a presidential aspirant currently now. I left him for this place. Dr. Fayemi is coming here on his presidential bid. But because this is very, very significant to us, we can't look away from it. So I have to leave him and come here. And he's in the know. And I can tell you, he's silently watching what we are doing here. As you have come here, by the grace of God, I pray you return safely. And I wish you successes in your endeavor. Thank you, and God bless.
Thank you very much for coming, sir. We are very grateful. Now we understand that we are very tired, so we'll start serving refreshment now. In a matter of minutes, we'll get to you, please. So we'll have just the last session, and then our speakers can return to their seats. It's been a very exciting adventure. I want to believe that we have all been able to contribute to the discussions. So the very last discussion now, Group 1 will be having Mr. Debussy for sexual and reproductive health and rights. Group 1, Mr. Debussy, sir. Group 1, please, a round of applause. The very last session. Group 2 will be having Mr. Joshua Koya from Unguvu Health. Group 2, Mr. Joshua Koya from Unguvu Health. Group 3 will be having a rep from Hasty Health Initiative. Group 3, a rep from Hasty Health Initiative. Group 3, a round of applause, please. A round of applause. Group 3, please, a round of applause. Food is coming. We are sorry. Now, it's on the way. We experienced some delay. Yes, we experienced some delay. It will get to you. I promise you that. At least drinks will be served first. Group 4, we have our rep from Mediplan HMO. Group 4, our rep from Mediplan HMO. Group 4, a round of applause, please. Thank you very much. Group 5, our rep from the Primary Healthcare Board. Group 5, our rep from the Primary Healthcare Board. Group 5, can you wave your hands? Thank you. Group 6, we have Dr. Adeni Yogini. Group 6. Group 6, Dr. Adeni Yogini. Thank you very much. Dr. Gini will be joining us soonest, as soon as our special advisor to the governor has taken his leave. So thank you very much. We'll go for 10 minutes, and while this is on, we will share refreshment, please.
Yeah. Mental health team. If you know that you had a fantastic session or you had fantastic sessions on your table, please put your hands together for all the roundtable speakers. I must honestly queue behind the organizers of these events to appreciate the speakers staying this long, dedicating your time, your energy, and the wealth of knowledge that you have to younger people. It's highly appreciated, commendable. The Lord bless you. All right, right about now, we still have some more giveaways. Just relax. But then, I was having a conversation at the DJ stand there, and they were telling me that Wizkid fans are bigger than Davido fans. Is it true? Eh? Wait. If you don't say you be OBO fan, if I say OBO, you say baddest. OBO. And if you know say na Wizkid, Machala. When I say Wizkid, you say Starboy. Wizkid. All right about, we're going to be doing the Davido, the Wizkid jams back to back. Let us see whichever fan is going to win it. DJ, drop it. Let's do it sometime. Hey. Let's see who's winning.
You think you have a mental health problem, you probably do have some kind of mental health problem. That is one of the first things I tell people.
I'm the lightest man alive.
The mental health, the mental space is like actually, the major space, of operation. So if that place is not healthy, if that place is not in the best condition, I mean, your productivity is going to be absolutely very low. So, I mean, I would say that, I've just, managed, to, level up and then, also trying, within my capacity to also, make sure that the condition of that work environment is better for everyone. Because I know that if I have staff that are not, functioning well, that they are not in the right mental space, it will definitely have a corresponding effect on me and the kind of, work and productivity they churn out.
My stories from my personal experiences, my friends' experiences. So when it gets to a point where there's a story I can tell, then I'll tell a story.
So what I'm going to bring in here is Joshua Koya. He's the founder and CEO of a specific kind of online therapy session. He explains why he did it and what the need is in his part of the world. Here's Joshua.
The trigger was the pandemic and the anxiety of being isolated. But the broader reason is that 100 million Africans have been estimated to live with depression. They have limited access to mental health care and cannot even afford the available care. This inspired Nguvu Health to offer easy and affordable access to licensed therapists for Africans anywhere in the world. Nguvu actually means strength in Swahili, and it's a reassurance of our tenacity to do life no matter what. On our app, you can speak to a therapist, you can have screening.
So what I'm going to bring in here is Joshua Koya. He's the founder and CEO of a specific kind of online therapy session. So what I'm going to bring in here is Joshua Koya. He's the founder and CEO of a specific kind of online therapy session. He explains why he did it and what the need is in his part of the world. Here's Joshua.
The trigger was the pandemic and the anxiety of being isolated. But the broader reason is that 100 million Africans have been estimated to live with depression. They have limited access to mental health care and cannot.
You think you have a mental health problem, you probably do have some kind of mental health problem. That is one of the first things I tell people.
I'm the lightest man alive.
The mental health, the mental space is like actually, the major space, of operation. So if that place is not healthy, if that place is not in the best condition.
You think you have a mental health problem, you probably do have some kind of mental health problem. That is one of the first things I tell people.
I'm the liveliest man alive.
The mental health, the mental space is like actually, the major space, of operation. So if that place is not healthy, if that place is not in the best condition, your productivity is going to be absolutely very low. So, I would say that, I've just, managed, to, level up and then.
You think you have a mental health problem, you probably do have some kind of mental health problem. That is one of the first things I tell people.
I'm the liveliest man alive.
The mental health, the mental space is like actually, the major space, of operation. So if that place is not healthy, if that place is not in the best condition, your product.
So what I'm going to bring in here is Joshua Koya. He's the founder and CEO of a specific kind of online therapy session. He explains why he did it and what the need is in his part of the world. Here's Joshua.
The trigger was the pandemic and the anxiety of being isolated. But the broader reason is that 100 million Africans have been estimated to live with depression. They have limited access to mental health care and cannot even afford the available care. This inspired Nguvu Health to offer easy and affordable access to licensed therapies for Africans anywhere in the world. Nguvu actually means strength in swag.
Plenty, may I give you? I mean, you don't want
Tenacity to do life no matter what.
MTN. Photographers have on. Is it this life? Eh? This life no balance. The guy drop camera. He said, "Wait, to MTN." Are you ready? I'm going to play music small. 9235 21 79 4000 248 07. Who chop 'em? Aish. Ladies and gentlemen, we've got our winner, 1,500 naira at time. Sorry, no day. It's just MTN and glue. Don't worry, borrow your time from Ete if you want to call that your boyfriend. Borrow your time. Globacom. Let's do Glow. All right, are you guys ready? 27. I beg all these people they serve drink. Am I back baby meal? We will change this place. Just they come like that. Just bring one like that. You don't forget 27. All right, let's start all over again. Glow 27 549 501 5784 755. Who chop 'em? Who chop 'em? Where you dey? 1,500 at the back. Congratulations. We'll do some more MTN. Sorry, they don't see Airtel and Etisalat, no vex. Sakpa is indeed a strong thing. Are you ready, MTN? Protocol self stand correct. 7 job at time. Oh God. DJ, show yourself no go press. 93 191754634730 Uchopam. Hey, Vade! Hey! Oh, do not they give? Glow! We have enough to share. Are you ready, Globacom users? 27549 60549 again. 66491. Uchopam. Glow. Glow. Bad guy. Hook ball. May I see the kind of phone it is? Raise your phone up. The speed with which, you got it. All right, quickly, there are more giveaways, but I think I want us to go back to the olden days. Let's do some throwback jams. DJ Ibix, I'm sure, you have what it takes to take us back memory lane. Let us see how we can turn this place up a little more. As every table gets refreshments. I think people, if you've not gotten any refreshments, let me see your hand. Okay, on this side, I think they're serving people here. Don't worry, to get to you, I can assure you. DJ, come on, give me travailler. Can we do some old school? Then we'll come back to the new generation. Just have some more fun before we call it a day finally. I'm honestly having a good time. And remember, be like myself, go do personal giveaway yourself. I think I'm in the mood. Pick up your phone, go to Instagram. Say, if you follow me. As I stand like this, if you follow me. Yeah, talk him. Eruba. Go to Instagram and check me out. Yeah, come. Come first. Please show us some love. Put your hands together for her. Come. She doesn't even know what I wanted to give her. What is her love? So you can check out MC_Akinola. MC_Akinola. And I'm serious. MC_Akinola. Check me out on Instagram. I might just be in the mood to do one or two things for you guys. MC_Akinola. MC Akinola. Follow me, I will follow you back, actually. No, I'm charging my phone, I will follow you back. Are you ready for me, DJ? All right, baby, it's okay, let's do some old school back-to-back journey.
So what I'm going to bring in here is Joshua Koya. He's the founder and CEO of a specific kind of online therapy session. He explains why he did it and what the need is in his part of the world. Here's Joshua.
The trigger was the pandemic and the anxiety of being isolated. But the broader reason is that 100 million Africans have been estimated to live with depression. They have limited access to mental health care and cannot even afford the available care. This inspired Nguvu Health to offer easy and affordable access to licensed therapists for Africans anywhere in the world. Nguvu actually means strength in Swahili, and it's a reassurance of our tenacity to do life no matter what. On our app, you can speak to a therapist, you can have screening tests, and you can keep a voice diary. But our challenge so far building this is that we are
When you try to fight or hide your feelings, you're basically keeping a secret. Studies have found that keeping secrets can be stressful on the body and your mental health. Are you feeling worked up and overwhelmed by your daily activities or even your thoughts? We don't want you to stress anymore, so we built Nguvu with love for your mental health and general well-being. To get access to our effective and affordable therapy, create an account, take a quick assessment, select your therapist. All our therapists are licensed. Then start your mental health journey.
You think you have a mental health problem, you probably do have some kind of mental health problem. That is one of the first things I tell people.
I'm the lightest man alive.
The mental health, the mental space is like actually, the major space, of operation. So if that place is not healthy, if that place is not in the best condition, your productivity is going to be absolutely very low. So, I would say that, I've just, managed, to, level up and then, also trying, within my capacity to also, make sure that the condition of that, work environment is better for everyone. Because I know that if I have staff that are not, functioning well, that they are not in the right mental space, it will definitely have a corresponding effect on me and the kind of, work and productivity they churn out.
My stories from my personal experiences, my friends' experiences. So when it gets to a point where there's a story I can tell, then I'll tell the story.
To meet them, to hasten them up, to get sure that the refreshments get here soon. So please just give us some more time. Are we on the same page? Especially that girl who use glasses. She's not on the same page with me. But please let us. It's almost something beyond their control, but now they are trying to ensure that it is under control. So. In the meantime, we're just going to vibe to some good music, and you'll be seeing my face shortly. Yeah, DJ, it's okay.